So, good morning, everyone. Yeah. So, yesterday, if you remember, we started with antiplatelet, we finished with antiplatelet. They were used in MI and stroke, like aspirin, ADP receptor blocker, Grel and Grelor, GP2B3A inhibitor, E80, eptifibatide, apixaban, tirofiban. Then we discussed phosphodiesterase inhibitor, etc. Then we also started with anticoagulants. If you remember, anticoagulants, where they were used when there is excessive deposition of fibrin, and excessive fibrin deposition occurs in leg veins because of immobility. That condition is known as DVT, deep venous thrombosis. If it is occurring in heart because of atrial fibrillation, there will be a thrombus in left atria which may embolize into brain, which may lead to transient ischemic attack or stroke. Plus, we also discussed about DIC, disseminated intravascular coagulation, in which there is over formation of fibrin because of overactivation of clotting pathways. Then we started that what are the different types of anticoagulant drugs we have. We divided them into oral versus parenteral. Among oral anticoagulants, we were having three classes of drug. If you remember, one is vitamin K antagonist, which were inhibiting VCOR enzyme competitively, and those drugs are coumarins like warfarin, acetylcoumarin, bis-hydroxycoumarin, etc. We also discussed factor 10A inhibitors, apixaban, rivaroxaban, edoxaban. They are ending with the word exaban. And we discussed about direct thrombin inhibitor. The only drug was dabigatran. We compared them, which clotting factors they are reducing. The first one was reducing 2, 7, 9 and 10. Second was reducing factor 10. And the third, dabigatran, was reducing factor 2. The first one, coumarins, warfarin, they require monitoring. Monitoring is known as PT with INR. Other do not require monitoring. They are much safer drug. And also we discussed their antidote if bleeding occurs. So we discussed the antidote for warfarin was vitamin K1. We also discussed antidote for apixaban-like drug, that was recombinant factor 10A, that is indexanet alpha. And for dabigatran, we have made an antibody known as idarucizumab. Okay, I hope you remember that point. Then, nahi bacha, it is pre-foundation, not foundation. Okay. Now let's move ahead. Then we discussed about oral anticoagulants. Among them, we started with warfarin. We discussed that warfarin name, Wisconsin Alumni Research Foundation. It's a coumarin derivative. We discussed how the name has come. We discussed how vitamin K was required for synthesis of clotting factors. Vitamin K causes gamma carboxylation of glutamate of various clotting factors and anti-clotting factors. So it is responsible for synthesis of clotting as well as anti-clotting factor. Clotting factors were your 2, 7, 9 and 10, and anti-clotting factors were protein C and protein S. So this vitamin K regeneration into active form require VCOR C1 enzyme, vitamin K epoxide reductase enzyme, and warfarin like drug or coumarins like drug, they inhibit this enzyme. Okay. And we discussed that as warfarin is inhibiting multiple clotting factors, the first factor which reduces is factor 7 in 6 hours. That is why warfarin require PT monitoring, prothrombin time monitoring, because it's a part of extrinsic pathway. Then the second factor which reduces is protein C, and the last factor which reduces after 4 to 5 days or around 100 hours, 100 to 110 hours, is factor 2. This is an important question. That is why complete anticoagulant effect comes after 5 days. It cannot be used in emergency, while in initial 5 days, warfarin may rather increase the risk of bleeding. Increase the risk of coagulation. Why? Because of deficiency of protein C mainly and protein S also. So that is why with warfarin we always combine heparin, because heparin has immediate action. Then we discuss the properties of warfarin. Agreed? Absorption, distribution, metabolism, elimination. We discussed it's a highly protein bound drug, no role of hemodialysis. We also discussed it has a racemic mixture. S form is active, metabolized by CYP2C9. And that CYP2C9 is present in very less amount. That is why warfarin shows zero order or saturation kinetic. Agreed. And elimination is mainly by urine, by CYP enzymes. We discussed some pharmacogenetic testing. We will not go into that detail for a moment. And we also discussed about that warfarin requires monitoring. Monitoring is known as PT with INR. INR we discussed is international normalized ratio, PT of patient upon the normal PT of lab. And the values of INR tells us that how much dose of warfarin should be given as a maintenance anticoagulant. So we discussed, and this INR we should give warfarin for this condition, like 2 to 2.5 prophylaxis of DVT, 2 to 3 treatment of DVT and after knee and hip surgery, more than 3 prosthetic heart valve, AF with MS, and recurrent DVT and PE. Agreed? If you remember, just recapitulate the notes. Then we also discussed that what are the side effects of warfarin, and the major side effect is bleeding. And how to manage bleeding due to warfarin we also discussed. If the patient is asymptomatic but INR is raised, give vitamin K in different doses. And if the bleeding starts, you have to give fresh frozen plasma. Okay, instant source of clotting factors from outside. And you can also use PCC, that is prothrombin complex conjugate, which is a better drug but unfortunately very expensive, so rarely used in India, more commonly used in developed countries like America. We also discussed the interactions of warfarin. Okay, and then we started with other oral anticoagulants. They are much safer. They do not require any monitoring, and the good thing about them is they are much safer. They are used in all conditions like warfarin only, except prosthetic heart valves. Okay. So now we will be starting. Now we will be starting with the rest of the topics. Let's make a heading. So yesterday we completed with oral anticoagulant. Let's start now with parenteral anticoagulants. Everyone make a heading. Parenteral anticoagulants. Parenteral here word means injections. Parenteral word here means injections. Now if you remember the notes, can you tell me 2 parenteral anticoagulants I have told you? 2 parenteral anticoagulants I have told you. Okay. The 2 parenteral anticoagulants which I have told you were direct thrombin inhibitor and indirect thrombin inhibitors. Okay, just write in your notes. So we discussed this classification also yesterday. Yes, very good. Now we have to remember that indirect thrombin inhibitors, they are known as heparins, and heparins we will discuss in very great detail, just like warfarin. इसको बहुत डिटेल में पढ़ेंगे अभी हम heparins को. But let's discuss first about direct thrombin inhibitors. Let's discuss about direct thrombin inhibitors first. So what are the drugs we have among direct thrombin inhibitors? We will write heriudin, lepirudin, desirudin, bivalirudin. Sir, easy है नाम याद करना. How to remember their name? They are very rude drugs. They are ending with the word riudin. So they are very rude drugs. They are ending with the word riudin. This is the first slide of the day, बच्चों. This is the first slide of the day. इससे पहले तो सर इंस्पिरेशनल कोट्स लिखे हुए थे, बट दिस इज द फर्स्ट स्लाइड ऑफ द डे. पेरेंटरल एंटीकोगुलेंट्स. ओके ओके, very good. Maria ji, you are absolutely right. Direct and indirect. Shivani, Shruti, you are all are right. Now, as you can see this part, they all are ending with the word riudin. So you can easily identify that they are injectable drug. But there is one drug with a different name you have to remember, ergotroban. And this is a very commonly asked question. What is ergotroban? And this is also very easy to remember. Tro means thrombin. AN means ban, means it is inhibiting thrombin. So thrombin को ban कर रहा है. You can easily remember this drug. Now, before going further, sir, what is the route of administration? The route of administration of these drugs is IV, intravenous. Okay, the route of administration is IV. अब सर आप दो बातें याद रखेंगे. Remember, any anticoagulant which is given intravenously requires monitoring. So what I have told you, any anticoagulant which is given intravenously requires monitoring. क्योंकि IV ड्रग दोगे, very fast action will come, bleeding का रिस्क बढ़ जाएगा. So any intravenous anticoagulant you will give will require monitoring. So tell me, will it require monitoring? Yes. Because it is an intravenous drug. Second point you have to remember, in parenteral anticoagulant, if you remember oral anticoagulant, we were giving warfarin, and warfarin require PT monitoring. You have to remember, any intravenous anticoagulant require APTT monitoring. Any intravenous anticoagulant require APTT monitoring. Now what is the reason behind it? Let's wait for a second. I will explain you later. ठीक है बच्चों? Okay. So can you tell me which factor it will reduce? Direct thrombin inhibitor. Direct thrombin inhibitor will cause deficiency of which factor? Deficiency of which clotting factor? So thrombin I think is factor 2. है ना बच्चों, फैक्टर 2. एंड आई विल टेल यू दैट थ्रोम्बिन इज वन क्लॉटिंग फैक्टर विच एक्टिवेट इंट्रिंसिक पाथवे. थ्रोम्बिन क्या करता है? इंट्रिंसिक पाथवे के क्लॉटिंग फैक्टर्स को एक्टिवेट करता रहता है ताकि और थ्रोम्बिन बने. दिस पॉइंट आई विल एक्सप्लेन यू इन हेपेरिन्स. ओके, नाउ लास्ट पॉइंट विद देम इज व्हाट आर द यूजेस. ओनली वन यूज. द ओनली यूज ऑफ direct thrombin inhibitor is when you cannot give heparin to your patient, then we use this drug. So you will write that they are the drug of choice. नहीं बेटा, थ्रोम्बिन फैक्टर 2 होता है यार, मुझे थोड़ा बहुत याद है. ठीक है बच्चों, थ्रोम्बिन आई थिंक इज फैक्टर 2. So it is the drug of choice for heparin induced thrombocytopenia. It is a hypersensitive condition. It is hypersensitivity to heparin. एक टाइप की हाइपरसेंसिटिविटी होती है. It is a very dangerous condition. It's a very dangerous condition. In this condition we never give heparin. I will tell you what is heparin induced thrombocytopenia. HIT word याद रख लो हिट में. We give this drug in HIT. ठीक है बच्चों. यस, ऋषु कुमार हैज सेड दैट थ्रोम्बिन एक्टिवेट 5, 8, 9 एंड 11. दे ऑल आर पाथवे ऑफ इंट्रिंसिक पाथवे. और इंट्रिंसिक पाथवे का हम कौन सा टेस्ट करते हैं? एपीटीटी. ओके ओके, चलो आगे बढ़ते हैं. देख लेना बच्चों, 2 है कि 3 है, बहुत कंफ्यूजन रहती है, कोई बात नहीं, आगे बात करते हैं. I hope you have understood this simple part. So these drugs are given when there is allergy to heparins, then we give this drug. Now before going further, we go further. See this drug Heriudin. Heriudin is obtained from saliva of leeches. ठीक है. Heriudin is obtained from saliva of leeches. Now it is not available. कौन leeches को पकड़े, माउथ ओपन करे, saliva निकाले? So it is commercially now unavailable. Lepuridin you will write liver safe. Ergatroban you will write renal safe. And among them, which is the most preferred drug for HIT? Nowadays, the only available commercial preparation is ergatroban. Ergatroban is now considered as a drug of choice for HIT, heparin-induced thrombocytopenia. बाकी के ड्रग अब धीरे धीरे मार्केट से जाते जा रहे हैं, बैन होते जा रहे हैं, जरूरत ही नहीं है ना. Yes, thrombin is active form of prothrombin. Yes बच्चों, so it is factor 2. You are absolutely right, Rajni ji. Rajni ji, you are absolutely right. I hope you have understood this concept. Now, what is this heparin-induced thrombocytopenia? What is all this thing? Let's start with heparin. Now we will understand everything. Okay? Okay? बेटा थ्रोम्बोप्लास्टिन अलग चीज है, वो टिश्यू फैक्टर की तरह होता है, ये आप पैथ में पढ़ेंगे, है ना, फार्मा में नहीं पढ़ेंगे हम ये चीज. नाउ बच्चों, लेट्स टॉक अबाउट इनडायरेक्ट थ्रोम्बिन इनहिबिटर. फर्स्ट पॉइंट सर, व्हाट इज देयर मैकेनिज्म ऑफ एक्शन? No, bachcho, all drugs are given IV. All these drugs are given IV. All these drugs are given IV. ठीक है बच्चों? सामिया जी, all these drugs are given IV. Now, let's come to heparins. Now, sir, we have written it is an indirect thrombin inhibitor. मतलब ये भी thrombin को inhibit करेगा, but some indirect method. How? Very simple. Sir, in our blood, don't draw this diagram, we have one molecule. That molecule name is antithrombin. इस molecule का हमने नाम दे दिया antithrombin. Sir, when we give heparins to our patient, don't make this diagram, nobody will ask you. This heparin attaches to antithrombin. This heparin attaches to antithrombin. Okay? And this antithrombin becomes activated. And now it will inhibit clotting factors. I hope you have understood this part. So can we say that heparin is not directly inhibiting clotting factors? It is activating antithrombin, and antithrombin is inhibiting clotting factors. That is why they are known as indirect thrombin inhibitors. Yes, it is known as antithrombin 3. So you will write they activate antithrombin 3. I'm going to, मैं लिखने ही वाला था बच्चों ये बात, antithrombin 3. Now the point is, sir, how they activate antithrombin 3? They directly attach to antithrombin 3. Now the point is, if there is, जब हेपेरिन एंटीथ्रोम्बिन 3 पे अटैच होगा तो उसके सरफेस पे चेंजेस हो जाएंगे. इफ देर इज कन्फर्मेशनल चेंजेस और देर इज स्ट्रक्चरल चेंजेस, मतलब उसका पूरा स्ट्रक्चर ही बदल गया. स्ट्रक्चरल चेंजेस को हम बोलते हैं स्कैफोल्डिंग, फोल्ड हो गया. This antithrombin 3, when undergoes structural changes, it binds and inhibit factor 10. Which clotting factor it will inhibit? Factor 10. And when antithrombin 3 have structural changes, it inhibit both factor 10 as well as factor 2. ठीक है बच्चों? When antithrombin 3 changes, either conformational changes or scaffolding structural changes, पूरा ही बदल गया उस, then it will have this effect. So this antithrombin 3 will produce anticoagulant effect. Now the question arises, sir heparins क्या करेंगे? Heparins क्या करेंगे? Let's understand. Let's make a heading heparins, and then I will tell you that which heparin will inhibit which clotting factor. Okay? Which heparin will inhibit which clotting factor. So let's make a heading, very important topic, make a heading heparins. I hope you have understood this concept. Easy to understand? आसान है ना? Okay, easy. Chalo, let's make a heading heparins. So I am writing now heparins. Okay. Now, first we will write the normal things about heparin. Is heparin present in our body? Yes. Normally heparin is present in our body. It is present in mast cells or basophils and it is attached on epithelium of lung and intestine. Now, first point, it is present in mast cells or basophils. Sir, suppose this is mast cells and basophil. Suppose this is mast cell. Inside the mast cell we have heparin. And this heparin is attached to a molecule known as histamine. You know mast cells, they contain histamine. Mast cells, they contain histamine. Yes. Okay. Yes. Now remember one point. That this histamine is a basic molecule. This histamine is a basic molecule and this heparin is an acidic substance. So heparin is an acidic substance which attaches to a basic molecule histamine inside the mast cell. Before going further, you will write one point that heparin is the strongest organic acid in our body. What is the strongest organic acidic substance in our body is heparin. बहुत ही ज्यादा acidic होता है heparin. अब sir, why I am telling you this point? Why I am telling you this point? Because it will solve your 2-3 questions. Okay? It will solve 2-3 questions. See this diagram bachcho again. Sir, just think logically and tell me, sir, if I will give some basic drug, if I give some basic drug, let's say vancomycin, morphine, and ट्यूबोकुरारे, ये 3 ड्रग के नाम याद रखेंगे हम. When we give this any basic drug to our patient, these basic drug, they have a property that they enter into the mast cells and they bind to acidic substance heparin. Yes or no? And this histamine will be released. So basic drugs, they release histamine from mast cell. Basic drugs, they release histamine from mast cell. And we know, bachcho, that histamine causes inflammation or allergy. During inflammation or allergy, there is vasodilatation. Because of histamine release, vancomycin causes severe vasodilatation. The skin will become red. Vancomycin causes red man syndrome. Morphine causes asthma. And tuberculare may cause hypotension because of vasodilatation. I hope the concept is clear to you now. ठीक है बच्चों? So vancomycin causes red man syndrome, severe vasodilatation, flushing on skin. Morphine हमने पढ़ा था, asthma करता था. Why? Because it causes histamine release. Any drug which ends with the word curare, they are generally basic drug. They cause histamine release, hypotension. तो muscle relaxant है, जैसे ही लगाया patient hypotension में गया, मर गया. Okay? So this is the first concept. Second concept I want to tell you now on this part only. Let's come back. That heparin is the strongest acidic substance in our body. So what is the antidote for heparin? अगर हेपेरिन से ब्लीडिंग होगी, so antidote will be protamine sulfate. Why? Because protamine sulfate is a highly basic drug. It will act as a chemical antagonist of heparin. Basic drug will directly or chemically bind to heparin and it will directly neutralize heparin. When we are giving heparin as a drug, heparin blood में घूम रहा है, in our blood we inject protamine sulfate. Protamine sulfate will bind to heparin. Acid base reaction is known as chemical reaction. This type of antagonism is known as chemical antagonism. ठीक है बच्चों? Okay, I hope you have understood. So what was the antidote of warfarin? Vitamin K. What is the antidote of heparin? Protamine sulfate. Understood this point? So this is the normal things about heparin. But let's discuss heparin as a drug now. So let's talk about now heparin as a drug. Heparin as a drug is obtained from ox lung and pork intestine. Why? हमारे भी लंग और इंटेस्टीन पे होता है. इनके इंटेस्टीन पे सपोज दिस इज द एपिथेलियल सेल्स, हेपेरिन ऐसे अटैच्ड होता है. Heparin is attached like this. Okay. Now it is a mucopolysaccharide. It's a mucopolysaccharide. You don't have to remember this part. So it is attached. Now, bachcho, understand this part. When we directly obtain this heparin from pork intestine or ox lung, उनके intestine और lung के ऊपर जो heparin है, we directly obtain it. And when we use this crude preparation directly into humans, इसको directly humans में use करना शुरू कर दिया, this type of heparin, जिसको हमने बिल्कुल भी filter नहीं किया, we haven't filtered it and directly used in human, this form of heparin you will write is known as crude heparin. Do you agree with this point? This type of heparin is known as crude heparin. It is also known as unfractionated heparin. The third name is, it is also known as high molecular weight heparin. It is also known as high molecular weight heparin. I hope you have understood this point. Crude का मतलब directly निकाला, humans में use कर दिया without any filtration or fractionation. Fractionation means filter नहीं किया हमने. But problem with this heparin is it's a very dangerous drug. It will cause severe hypersensitivity. अभी हम डिस्कस करेंगे. बहुत सारी एनिमल से ऑब्टेन कर रहे हो, ह्यूमन में दे रहे हो, hypersensitivity होगी. Which hypersensitivity will be dangerous? HIT, which I will be telling you. So now we have made a much safer form of this heparin. We have taken this crude form of heparin and now we have filtered it. Now when we have filtered it, this is known as fractionated heparin. And this fractionated heparin is known as low molecular weight heparin. Low molecular weight heparin. Yes, Thanvi ji, yes. Other basic drugs may also release histamine from mast cells. Yes. Okay. Now हमने इसी को फिल्टर कर दिया बच्चों, इसी को फिल्टर कर दिया. It will be much safer drug, but the problem with this drug is still it causes hypersensitivity, which I will make you write. Now we have made a third type of heparin, which is not obtained from ox lung or pork intestine. No, we have made this heparin synthetically in our labs. ठीक है? We have made this heparin synthetically in our lab. It is known as ultra low molecular weight heparin. It is also known as synthetic heparin. Understood this point? So can you predict, before writing anything, can you predict that which heparin will not cause hypersensitivity? Can you predict that which heparin will not produce HIT, heparin induced thrombocytopenia, और you can say hypersensitivity नहीं होगी? किससे नहीं होनी चाहिए? Which heparin will be the safest one? I need to know the answer. The answer will be ultra low molecular weight heparin. Okay. Yes, you're absolutely right, Rushi ji. Now, let's write their names. Sir, if the word only heparin is written, if the only word heparin is written, it always means which heparin? It always means high molecular weight heparin. If the only word heparin is written, it means crude heparin. What about these? You'll write, they will also end with the word parin. And what about this? It will end with the word perinux. It will end with the word perinux. X is silent, so it is known as perinu. So we can write certain drug like enoxaparin, dalteparin, tinzaparin. Easy. Here you will write fondaparinux. Very commonly asked question, what is fondaparinu? Idraparinux. I hope you can easily identify them. रटने की जरूरत नहीं है. Identify. नुक्स आएगा तो ये होगा. Okay. Now, what is important for us is we have to compare these three heparins. And the comparison chart which I will be making is a very important chart for you. बहुत important है आपके लिए वाला part. ठीक है? So let's compare them. Now, which clotting factor they will inhibit? Which clotting factor they will inhibit? You will write heparin, high molecular weight heparin. 10 and 2. 10, very less 2. 10 only. I hope now you know that how high molecular weight heparin will bind to antithrombin. Can we say when high molecular weight heparin binds to antithrombin, it will produce which changes? It will mainly produce structural changes. And when ultra low molecular weight heparin binds to antithrombin 3, it produces conformational changes. And low molecular weight heparin mainly produce conformational changes. Okay, अभी आते हैं बच्चों, why no hypersensitivity? Okay. Okay. Next point, molecular weight. MW bachcho stand for molecular weight. More than 15,000 किलो डाल्टन, और डाल्टन भी लिख सकते हो सिर्फ. Make it 1/3, around 5,000. Make it 1/3, around 1,500 किलो डाल्टन. ठीक है. थर्ड पॉइंट, व्हाट इज अ सोर्स? कहां से ऑब्टेन करते हैं? ऑक्स लंग और पॉर्क इंटेस्टीन. सर सेम, ऑक्स लंग और पॉर्क इंटेस्टीन सेम. सर इट इज अ सिंथेटिक पेंटासेक्राइड. It is a synthetic pentasaccharide. CF बच्चों clotting factor. नमन जी, CF stand for clotting factors. We are discussing the anticoagulant drugs, so CF मतलब anti clotting factor. ठीक है, कोई बात नहीं, हो जाता है यार, सबसे हो जाता है, नया नया पढ़ रहे हैं हम, कोई बात नहीं. चलो आगे बात करते हैं. Now what is the root? You'll write IV, SC, SC only, SC only. IV stand for बच्चों intravenously, SC stand for subcutaneously as an injection. ठीक है बच्चों. Now before going further, just write one point, a very important point, that anticoagulants are never given intramuscularly. They are never given as an intramuscular injection, क्योंकि सर मसल में इंजेक्शन दे दोगे, anticoagulant है, the blood will be collected inside the muscle. If the blood will be collected inside the muscle, it will lead to hematoma formation. That is why anticoagulant drugs, they are never given by which route, by which injection? Intramuscular. Understood बच्चों? Now my question from you is, you know that high molecular weight heparin can be given IV. Other heparins are not given IV. So tell me बच्चों, which drug requires monitoring? So which drug is narrow therapeutic index? And hence it requires monitoring. Which heparin will require monitoring? And which heparin will not require monitoring? You'll write yes, no, no. So high molecular weight heparin requires monitoring. And tell me, factor 10 आ रहा है and factor 2 आ रहा है. Factor 2 is coming. Because of factor 2, thrombin activates intrinsic pathway 5, 8, 9, 11. You will do which monitoring? APTT. Which monitoring we do in intravenous anticoagulants? Always APTT. Warfarin के साथ PT monitoring, इनके साथ APTT monitoring. Easy, आसान हो गया काम, है ना? आसान हो गया काम, है ना? Last point, how heparins are eliminated, how they are degraded in our body. High molecular weight heparin is degraded by heparinase enzyme in reticuloendothelial cells. Yes, Maria Abbasi ji, in low molecular weight and high ultra low molecular weight heparin, they do not require monitoring. Yes. So which will be safer drug? Safer drug will be low molecular weight and ultra low molecular weight heparins. Understood this point? APTT की full form पैथ में पढ़िएगा, activated partial thromboplastin time. ठीक है? They are eliminated by renal route in urine. Okay. So, which heparin is unsafe in renal failure? Ultra low molecular weight heparin and low molecular weight heparin, they are unsafe in renal failure. And in cases of renal failure, they require monitoring. They require monitoring in renal failure. Now the question arises, sir, which monitoring they require in renal failure? Okay. Which monitoring they require in renal failure? Bachcho, they are inhibiting which clotting factor? First tell me. Low molecular weight and ultra low molecular weight heparin, they are inhibiting which clotting factor? Factor 10 or factor 2? Tell me the answer first. They are inhibiting factor 10 or factor 2? First tell me the answer. Low molecular and ultra low molecular weight heparin? Sir, we know that they are mainly inhibiting factor 10. They are not inhibiting factor 2. फैक्टर 2 होगा तो एपीटीटी करेंगे, बट यहां पे फैक्टर 2 नहीं है. देर इज ओनली इनहिबिशन ऑफ फैक्टर 10. जस्ट सी द एक्टिविटी ऑफ फैक्टर 10. दैट मॉनिटरिंग इज नोन एज फैक्टर 10 एसए. फैक्टर 10 की एक्टिविटी चेक कर लो. ठीक है बच्चों, बिकॉज दे आर ओनली इनहिबिटिंग फैक्टर 10. Because they are only inhibiting in factor 10. Understood this point? Easy हो गया काम? समझ आ गया? Concept is clear? Yes. Concept is clear. Very good. Let's talk about now uses of heparin, side effects of heparin. So this chart which we have made, sir, this chart is very important for you. ठीक है, ये जो हमने चार्ट बनाया है, दिस चार्ट इज वेरी इंपॉर्टेंट फॉर यू एंड मेनी क्वेश्चन कम्स फ्रॉम दिस चार्ट. सो प्लीज रिमेंबर इट इज वेरी इंपॉर्टेंट. कंपैरिजन ऑफ वारफरिन. ठीक है, लेट्स टॉक अबाउट नाउ यूजेस ऑफ हेपेरिन. नाउ यू विल टेल मी द आंसर. ओके, first point, sir, if the patient of DIC comes to you, DIC is disseminated intravascular coagulation, it is emergency. Can you tell me certain causes of DIC? Sepsis, abruptio, cancer induced, thrombosis, catheter induced thrombosis. बच्चों, tell me which heparin would you like to give? Which heparin would you like to give? Tell me which heparin should be the drug of choice. Sir, emergency में which route would you like to give in emergency route? In emergency we give IV high molecular weight heparin. Yes or no? Very good, Nimra ji, you are absolutely right. This question has been asked many times. They have been asked many times. Next one. बच्चों, tell me prophylaxis of DVT and PE. Which heparin would you like to give? Or prophylaxis in AF with MS patient. Which heparin would you like to give? IV heparin or subcutaneous heparin? Here we will prefer to give subcutaneous, either low molecular weight heparin or ultra low molecular weight heparin. You can give any drug. Yes. So if I'll ask you prophylaxis of DVT in ICU patient who cannot take a drug orally, IV drug दोगे कि subcutaneous injection दोगे? Which is easier to give? Prophylaxis of DVT in ICU patient who cannot take a drug orally, you will give subcutaneous heparin. This question was asked and this option was given in AIMS question. ठीक है? Yes, it is given only by subcutaneous route. ठीक है? Only by subcutaneous injection. Below sepsis, beta, we have written abruptio. कल लिखा था ना abruptio placentae, amniotic fluid embolism, है ना? चलो आगे बढ़ते हैं. Next point we will write antidote for heparin. We know protamine sulfate. Protamine sulfate is an antidote of heparin, but it is an antidote for high molecular weight heparin and low molecular weight heparin. It is not effective against fondaparinux and idraparinux, which is ultra low molecular weight heparin. It cannot bind to ultra low molecular weight heparin. So protamine sulfate is an antidote for high molecular weight heparin and low molecular weight heparin. Okay, no beta, it is not given IV. प्रेजर्वेटिव वगैरह होते हैं उसमें, इस वजह से. ओके, आईवी के लिए हाई मॉलिक्यूलर वेट ही काफी है, इसके अलावा हमें जरूरत ही नहीं पड़ती. नाउ द पॉइंट इज, if you talk about them, we don't have any antidote for them. We don't have any antidote for fondaparinux and idraparinux. But now what we have done, we have taken this idraparinux and we have attached a molecule to it, biotin. And this drug has now become Idra Biota Perinux. Idra Biota Perinux. For this we have an antidote, that is Avidin. We have an antidote for this drug, Idra Biota Perinux Avidin, because Avidin binds to which molecule? Tell me. Avidin binds to which molecule? Avidin can activate this biotin. Avidin can activate biotin. Avidin biotin से bind कर जाता है. You will learn in PSM this part. So for Idra Biota Perinux we have an antidote. If bleeding occurs, we have an antidote. Done? Let's talk about the side effects of heparin. Side effects of heparin. First one, you will write, this is very important, alopecia. It binds to basic protein of hair. Heparin causes osteoporosis. Why? It binds to basic proteins of the bone. Okay. That is why give calcium supplements in pregnancy, because in pregnancy the demand of calcium increases. We are coming to this part. Which anticoagulant would you like to give in pregnancy? Third point, you will write heparin causes hyperkalemia. It increases potassium level. This question has been asked many times. The reason is heparin inhibit aldosterone synthesis. Heparin inhibit aldosterone synthesis, and you know, if you inhibit aldosterone, sodium will be excreted out in urine, potassium will be preserved in blood. कुछ नहीं बच्चों, इड्रा बायोटा पेरिनुक्स एक ड्रग है जो हमने, in which इड्रा पेरिनुक्स we have attached biotin molecule, and this drug we have named it as Idra Biota Perinux, and for this drug we have an antidote. Normally for Idra Perinux we are not having any antidote. For Idra Biota Perinux we have an antidote. That antidote is Avidin, because Avidin binds to biotin and neutralize it. Understood? आगे बात करते हैं. Now it decreases triglyceride level. Why? Although it is not a side effect, because it has lipase activity. Heparin in our body has lipase activity. It activates one enzyme present on endothelial cell, which I will be telling you, lipoprotein lipase enzyme. And last point, we'll write, next point is bleeding. And last point which finishes heparin is heparin induced thrombocytopenia. सर ब्लीडिंग के लिए कौन सा ड्रग दोगे? फॉर ब्लीडिंग वी गिव प्रोटामिन सल्फेट. नो बच्चों, इड्रा बायोटा मानसी जी विल बी लो, अल्ट्रा लो मॉलिक्यूलर वेट हेपेरिन. ओके बच्चों, एक बात बताओ, एक डीवीटी का पेशेंट है. इफ अ पेशेंट इज ऑफ डीवीटी, डू यू थिंक इट्स एन इमरजेंसी? If you have thrombus in leg veins, is it an emergency? No, sir, it is not an emergency. Okay. So, would you like to give an IV drug for this? No, sir. IV drug requires patient admission. It requires monitoring. Monitoring करनी पड़ेगी. DVT is not an emergency. In emergency, you give IV drug like disseminated intravascular coagulation. Understood? Think logically. Think logically. लाइपेज एंजाइम बच्चों डिक्रीजेस ट्राइग्लिसराइड. अभी आते हैं हम आईडीएल एचडीएल सब पे आएंगे, चिंता मत करो यार. और इसके बाद हम वही स्टार्ट करेंगे. ओके, यू आर स्टिल हियर. ओके, देख लो ये स्लाइड. यू वांट टू सी अगेन, यू कैन सी. ओके, चलो. नाउ सर इसको मार्क कर लो. दिस इज द लास्ट पॉइंट ऑफ हेपेरिन. दिस इज वेरी कॉमनली आस्क्ड क्वेश्चन, वेरी इंपॉर्टेंट. हेपेरिन इंड्यूस थ्रोम्बोसाइटोपेनिया. लेट्स अंडरस्टैंड व्हाट इज दिस कंडीशन. है ना, हमने कहीं लिखा भी था हेपेरिन इंड्यूस थ्रोम्बो. नाउ व्हाट इज हेपेरिन इंड्यूस थ्रोम्बोसाइटोपेनिया? आई वांट टू एक्सप्लेन यू फर्स्ट दिस पॉइंट. कैन यू टेल मी विच हेपेरिन कॉजेस HIT? The heparin which causes HIT is high molecular weight heparin and low molecular weight heparin. High molecular weight heparin and low molecular weight heparin. Okay. The incidence is more commonly seen with high molecular weight heparin. Second point. Okay. नाउ बेटा अभी पल्मोनरी एम्बोलिज्म पे भी आएंगे. नो, पल्मोनरी एम्बोलिज्म इज नॉट एन इमरजेंसी. मैसिव पल्मोनरी एम्बोलिज्म इज एन इमरजेंसी. विशाल जी अभी हम उस पे आएंगे, डोंट वरी, आई विल टेल यू ईच एंड एवरीथिंग. पल्मोनरी एम्बोलिज्म इज नॉट एन इमरजेंसी. मैसिव पल्मोनरी एम्बोलिज्म इज एन इमरजेंसी. ओके, डोंट, what I am telling you will be absolutely right. Okay, ज्यादा इधर उधर अभी मत भागो. जब चैप्टर खत्म हो जाएगा then ask me a question, what is this, what is that. Let me finish. Okay, no, P is not an emergency. No, Kabir ji, again I am telling you, P is not an emergency. Massive P is an emergency. Massive pulmonary embolism is an emergency. ठीक है, एक छोटा सा एम्बोलाई अगर लंग में चला गया आपको कुछ नहीं होने वाला. मैसिव चला गया तो राइट हार्ट फेलियर हो जाएगा, हेमरेज हो जाएंगे, तब आपकी डेथ होगी. ठीक है. नाउ फॉरगेट एविडेंस, बहुत हो गया एविडेंस, इस पे ध्यान दो. हेपेरिन इंड्यूस थ्रोम्बोसाइटोपेनिया क्या चीज है? सपोज दिस इज ब्लड एंड इन अवर ब्लड वी हैव प्लेटलेट. नाउ व्हाट हैपेंस? हेपेरिन, they come and attach to this platelet. Any molecule which attaches to a cell, we will write reason, what is the pathology. You'll write heparin act as a hapten for platelet. Now what does it mean? सर नॉर्मली प्लेटलेट के अगेंस्ट एंटीबॉडी नहीं बनती. नॉर्मली अगेंस्ट प्लेटलेट एंटीबॉडीज आर नॉट प्रोड्यूस बिकॉज दे आर अवर सेल्फ सेल. Now when heparin binds to its platelet, now antibodies will be produced against platelet. So what is hapten? Hapten is any molecule which makes a cell antigenic. Which makes a cell antigenic is known as hapten, and now antibodies will be produced against platelet. ठीक है? ठीक है? Okay. Next point. Sir, what is the clinical feature? Can you tell me, if I have written heparin-induced thrombocytopenia, the main problem is not bleeding. It is not bleeding. The main problem is this antigen and antibody platelet. It can attach on blood vessels and it can now block a blood vessel. This platelet with antibody can attach in a blood vessel. The main problem is thrombosis. Although it is thrombocytopenia, but the main problem here is thrombosis. Okay, ये ज्यादा dangerous है. Which thrombosis? You will write venous thrombosis, which is seen with artery thrombosis. Veins और artery block हो जाएंगी. सर अगर vein block हो गई, patient will suffer from DVT, and you have to amputate the limb of the patient. Patient का limb काटना पड़ेगा. और अगर artery block हो गई, patient को क्या हो जाएगा? MI और stroke हो जाएगा. Patient की अपने आप death हो जाएगी. And that is why this HIT is a very dangerous condition. This HIT is a very dangerous condition. Diagnosis. You'll write serotonin assay. Platelet, they release serotonin when they get damaged. Okay. Treatment. Stop heparin and never start again. Stop heparin and never start again. Is there any role of platelet transfusion? No role of platelet transfusion. Can you tell me why? Because sir, platelet के अगेंस्ट तो एंटीबॉडी बनी हुई है, कोई फायदा नहीं है. ओके, प्लेटलेट के अगेंस्ट क्या बनी हुई है? एंटीबॉडी बनी हुई है, कोई काम नहीं है. सो नाउ टू प्रिवेंट दिस थ्रोम्बोसिस, द ड्रग ऑफ चॉइस इज डायरेक्ट thrombin inhibitor, which is given IV parenteral, and that drug was ergotroban. But you can use other drugs if available, like hiriudin, lepuridin, etc. But I have already told you the drug of choice was ergotroban. The drug of choice is ergotroban. Second point, you can also give fondaparinux. Can you tell me why you can give fondaparinux? Because ultra low molecular weight heparin, they do not produce HIT. They are safe in HIT people. पढ़ा था हमने. Lastly, you can give danaperoid. Danaperoid is an oral synthetic heparin, not commonly used. Okay. Last point you will write, no role of warfarin. In your MCQ books, मार्केट में बहुत सारी MCQ बुक्स आती हैं, उसमें गलत लिखा है, in that books it is wrongly mentioned that you can give warfarin to prevent thrombosis in HIT. No sir, because if you will start warfarin, warfarin itself in initial days increases thrombosis. We know this part. I hope you have understood this concept now. No beta, it will not cause destruction of antigen or antibody complex. It will just do not allow the attachment of fibrin on platelet. It will just do not allow prevention of thrombus. बेटा थ्रोम्बिन भी ना प्लेटलेट्स को एक्टिवेट करता है. यू विल लर्न इन पैथोलॉजी. ठीक है, थ्रोम्बिन भी प्लेटलेट को एक्टिवेट करता है. सो डोंट गो इनटू दैट डिटेल फॉर अ मोमेंट. बट हमें हेपेरिन्स को बंद करना है. वी हैव टू स्टार्ट सम अदर एंटीकोगुलेंट. सो वी डोंट गिव इनडायरेक्ट थ्रोम्बिन इनहिबिटर हेपेरिन्स. वी रादर गिव डायरेक्ट थ्रोम्बिन इनहिबिटर्स, दैट इज ergatroban, hiruridin, lepuridin, bivaluridin, etc. Okay, so we have to give some anticoagulant, so we give this drug. And this drug, direct thrombin inhibitor, inhibit factor 2. Factor 2 inhibition also reduces platelet action. पैथोलॉजी नहीं रिपीट करनी हमें सिर्फ यही बात याद रखनी है. ठीक है बच्चों, ज्यादा हो जाएगा नहीं तो. ओके, done. This completes your anticoagulants. Let's make a heading. No, let's make a heading. Anticoagulation in pregnancy. Anticoagulants in pregnancy. Yes, you can give ultra low molecular weight heparin, fondaparinux, you can give. Okay. Anticoagulant in pregnancy. You'll write the drug of choice as an anticoagulant in pregnancy is heparins. You can give any heparins you want, but the most preferred is low molecular weight and ultra low molecular weight heparin. Okay. You'll write, what about warfarin? Warfarin is contraindicated in first trimester. Can we write first trimester means up to 12 weeks? Remember, when you talk about treatment of any disease or any medical term, here 1 month means 28 days or 4 weeks. ठीक है? In medical terms, 1 month means 28 days. Always. Why? Because warfarin causes fetal warfarin syndrome. Fetal warfarin syndrome. Now what happens in fetal warfarin syndrome? It's very simple. There is bone and cartilage defect. Why? Reason, because warfarin decrease osteocalcin production. Because osteocalcin is vitamin K dependent bone forming protein. And we know, sir, warfarin inhibit vitamin K. I hope you have understood this point. So does our bone require vitamin K also? Yes. हमारी bone को vitamin D तो चाहिए ही चाहिए. But vitamin K is also required for bone formation. Remember, I will tell you later on, vitamin K deficiency also causes osteoporosis. Why vitamin K deficiency causes osteoporosis? Because vitamin K is responsible for formation of osteocalcin. है ना, पढ़ा था हमने ये पॉइंट, फेनिटॉइन में भी पढ़ा था ये पॉइंट. So what are the features? So features we will write are, features of that child will be, you will write saddle nose, limb hypoplasia, and microcephaly. Okay. Plus it will also lead to, as it is an anticoagulant, it causes fetal hemorrhage. Why fetal hemorrhage? Because it is anticoagulant drug. Because it is anticoagulant drug, it causes fetal hemorrhage. Done. So if a pregnant female comes to you, which anticoagulant drug you will give? So let's see how we will give. So if a pregnant female comes for 1 to 12 weeks, can you tell me what should be the drug of choice? Heparin. 12 to 36 weeks, warfarin. 36 weeks to 1 day before delivery. Again you will switch to heparin. During delivery, no anticoagulant, because anticoagulant will increase the risk of postpartum hemorrhage. है ना, bleeding नहीं रुकेगी ना, after child delivery bleeding will not stop. So during delivery we never give any anticoagulant drug. I hope it is clear. Now the question which was asked in AIMS November exam was, there is a pregnant female who come to your OBS OPD. At what time, question was, just hear the question first, at what time or during which week you will switch that female from heparin to warfarin? हेपेरिन से वारफरिन पे कब स्विच करना है? When you will switch from heparin to warfarin? Answer is, you switch from heparin to warfarin after first trimester 12 weeks. I hope you have understood this part. You switch from heparin to warfarin after first trimester or 12 weeks. So this is an important MCQ. This is commonly asked. ठीक है, याद रखना है. After 12 weeks. Done? Done? So मुबारक हो, आपका एंटीकोगुलेंट्स खत्म हो गया. Let's write a very small topic, that is opposite drug, procoagulants. Procoagulants. So not a very important topic. In this only 1 or 2 drugs are important. PPH beta postpartum hemorrhage. बच्चा डिलीवर होगा, ब्लीडिंग नहीं रुकेगी ना, एंटीकोगुलेंट ड्रग. नो. फीटल वारफरिन सिंड्रोम फर्स्ट ट्राइमेस्टर. ठीक है. Procoagulant. First let's write the names of the drugs. Okay. Vitamin K. You'll write recombinant clotting factors which are given for respective deficiencies. Desmopressin. बच्चों, where desmopressin is given? I hope we have discussed this part. Okay. Ethamsilate. Okay. Now, the only drug you have to learn in great detail is this one. Okay. Okay. Vitamin K. So, vitamin K we will discuss now. Okay. Let's talk about, make a heading vitamin K. So, we have to write many points about vitamin K. Heparin attaches to platelet. Yes, it attaches. Why it attaches? God knows. But it attaches. Yes, Maria ji, what is your question? What is your question, Maria ji? Why warfarin is not dangerous after 12 weeks? Because before 12 weeks, the placenta is not produced, not formed properly. After first trimester, the placenta gets properly formed. That is the reason. Placenta भी एक चीज है ना, placenta से cross नहीं हो पाता after 12 weeks. That is the reason. है ना, जैसे जैसे. Now, what about premature labor? You know what is premature labor, Miss Baji? Premature labor doesn't mean anticoagulant. Premature labor होता है 36 weeks से पहले हो रहा है तो. That is premature labor. It has other causes. It is not related to any anticoagulation. ठीक है, हम ड्रग्स की बात कर रहे हैं. Premature labor के अलग reasons है. Okay? चलो, इथैमसाइलेट कोई ड्रग है, बस याद रखना है आपने. ओके, यू डोंट हैव टू गो इनटू दैट डिटेल. व्हाट यू हैव टू गो इनटू दैट डिटेल, इस पे याद करना है विटामिन के. सो लेट्स राइट अबाउट विटामिन के. नाउ विटामिन के हैज 3 फॉर्म्स, K1, K2, K3. K1 is known as phytonadione, which is also known as phylloquinone. Minaquinone, and menandione. And menandione. ओके. जितेंद्र जी, प्रेग्नेंट में HIT होगा तो बंद कर दोगे? यू विल स्टार्ट हेरियोडिन लेपिरिडिन लाइक ड्रग. इथैमसाइलेट इज अ ड्रग विच इंक्रीजेस coagulation. Okay. Amisha is asking what is the advantage of using heparin in 12 to 36 weeks. The major advantage of using warfarin, is it's an oral drug. Would you like to take injections for 9 months? Any of the student can answer me. आपको कोई बीमारी है. Would you like to take injections for 9 months, 1 year? Would you like to take everyday injections? Or would you like to take an oral drug? We will always prefer to give an oral drug to our patient. Cheaper, convenient, safer. Injections are less preferred over oral drug. If you have to give a drug on long-term basis, the simple reason is that. है ना? That is the reason. Yes. I hope now you have understood. Yes. ठीक है? आगे बात करते हैं. चलो, कोई बात नहीं, होता है. इन सेकेंड ईयर वी हैव लॉट ऑफ क्वेश्चंस. स्लोली एंड स्लोली सब खत्म हो जाएगा. 3-4 साल बाद क्वेश्चंस भी पूछना बंद कर दोगे आप. ठीक है. नाउ कैन यू टेल मी, विटामिन के इज अ फैट सॉल्युबल विटामिन और वाटर सॉल्युबल विटामिन? वी नो दैट विटामिन के, ADE के आर फैट सॉल्युबल, बट यू विल राइट दैट दिस menandione is a water soluble form. It is a water soluble form of vitamin K, and this menandione is contraindicated in G6PD deficiency, and G6PD deficiency are very commonly seen in neonates. It is very commonly seen in neonates. ठीक है. अब बात करते हैं uses of vitamin K. Uses of vitamin K. Pregnant woman with prosthetic heart wall. किशन जी इज आस्किंग मी. चलो बिफोर गोइंग फर्दर, बड़े सारे क्वेश्चंस है, पहले मैं उनको आंसर कर देता हूँ. किशन जी इज आस्किंग मी, pregnant woman with prosthetic heart walls. First thing we will tell to that patient is never get pregnant. Avoid pregnancy. This is the first thing we tell our patient. Okay? Avoid pregnancy. In prosthetic heart wall patient, we tell the female not to get pregnant. बिकॉज प्रेगनेंसी में प्लाज्मा वॉल्यूम बढ़ता है, हार्ट पे प्रेशर पड़ता है, पेशेंट का हार्ट फेलियर हो सकता है. प्रेगनेंसी इज अ रिस्क फैक्टर इन दैट केस. गलती से प्रेग्नेंट हो गई, एडवाइस फॉर अबॉर्शन. ठीक है, देर आर मेनी एस्पेक्ट्स ऑफ दिस. वी आर डिस्कसिंग जस्ट फार्मा बच्चों, हमें अभी फार्मा पे ही रहना है. किशन जी, आई होप द थिंग्स व्हेन द पेशेंट कम्स इन ओपीडी and you will not just go with the books, you have to apply logic. सर प्रेगनेंसी डेंजरस है हार्ट के लिए, है ना, प्लाज्मा वॉल्यूम बढ़ता है, हार्ट पे प्रेशर पड़ता है, 30 वीक्स पे बहुत ज्यादा हार्ट फेलियर का चांस भी बढ़ जाता है. सो ऑल दीज थिंग्स आर देयर. चलो आगे बात करते हैं. लेट्स कम बैक टू दिस. सो आई एम हेयर टू टीच यू फार्माकोलॉजी. आई विल टीच यू ओनली दैट. ओके, आई विल नॉट टीच यू हाउ टू मैनेज पेशेंट्स राइट नाउ. दैट आई कांट टीच यू इन अ स्टूडियो, है ना. That is a something practical. It's an experience you will learn yourself actually. With time you will learn. But yes, you're right, asking very good questions. I really appreciate that. So what are the uses of vitamin K? First is vitamin K deficiency. Okay. Vitamin K deficiency. Like, can you tell me, sir, what is the cause of vitamin K deficiency? First, I will write dietary deficiency. Now, bachcho, remember one thing. Sir, this is our GIT. Don't draw this diagram. In GIT, we have colonic bacteria. Sir, this colonic bacteria, they synthesize vitamin K for us. जीआईटी वाले बैक्टीरिया हमारे लिए विटामिन के बनाते हैं. दे मेक विटामिन के फॉर अस. वी नो दैट विटामिन के इज अ फैट सॉल्युबल विटामिन. सो दिस फैट सॉल्युबल विटामिन रिक्वायर व्हाट? इट रिक्वायर बाइल. Don't draw this diagram, because for absorption of any fatty molecule you require bile. First cause of vitamin K deficiency is obstructive jaundice. Can you tell me why obstructive jaundice? Why obstructive jaundice will have vitamin K deficiency? सर बाइल नहीं आता. बाइल नहीं आएगा तो क्या होगा? प्रॉब्लम हो जाएगी. सेकेंड, एंटीबायोटिक यूजेज. सर वाई एंटीबायोटिक यूजेज? बिकॉज एंटीबायोटिक्स दे विल किल GIT bacteria. Antibiotics, they will kill GIT bacteria. Antibiotics, they produce vitamin K deficiency. Okay? Yes. Last point. Sir, when a child is newly born, एक बच्चा भी पैदा ही हुआ है, does that child will harbor colonic bacteria? क्या उस बच्चे में बैक्टीरिया होंगे? दैट कंडीशन इज नोन एज, ऐसे बच्चे में ब्लीडिंग का रिस्क बढ़ सकता है. और नियोनेट्स, बिकॉज नियोनेट्स दे डोंट हैव एनी बैक्टीरिया इन देयर बॉडी. यस, ओके, एनी बैक्टीरिया इन देयर बॉडी. नेक्स्ट पॉइंट, इट इज यूज एज एन एंटीडोट फॉर warfarin poisoning. It is also given as an antidote for aspirin poisoning, because aspirin, just like warfarin, may cause vitamin K deficiency. Lastly, it is also given for osteoporosis due to phenytoin. So these are the uses of vitamin K. बच्चों, मुंतेहा जी, Why to switch over to heparin after 36 week? सर 36 वीक्स के बाद कभी भी डिलीवरी हो सकती है ना? टेल मी बच्चों, मुंतेहा जी, आई वांट टू आस्क यू वन क्वेश्चन. टेल मी yes or no answer. After 36 weeks, bleeding delivery can occur anytime. Tell me, when you give warfarin inhibits synthesis of clotting factor. And when you will stop warfarin, क्या anticoagulant effect suddenly खत्म हो जाएगा? After stopping warfarin, its effect comes after 5 days. And when we give warfarin, liver is not making clotting factors. When you will stop warfarin, क्या उसका एंटीकोगुलेंट इफेक्ट सडनली खत्म हो जाएगा? नहीं होगा सर, है ना? लिवर बना ही नहीं रहा. क्लॉटिंग फैक्टर सिंथेसिस में टाइम लगेगा. नई वाली फॉर न्यू क्लॉटिंग फैक्टर सिंथेसिस इट विल टेक टाइम. बीच में अगर डिलीवरी हो गई तो सर ब्लीडिंग होती रहेगी. So that is why you need an injectable heparin. Heparin has immediate onset of action. Heparin has immediate offset of action also. उसका एक्शन सडनली आता है, सडनली चला जाता है. So that is why after 36 weeks drug, you need a drug which will have a very predictable action. Why you want to give warfarin? Even if you will stop warfarin, अगर बच्चा हो रहा है, the child is delivered, even if you stop warfarin, its anticoagulant effect will persist. Understood this point? समझ आ गई बात? तो there is a reason behind it, everything. इसलिए देते हैं यार, है ना? चलो, विटामिन के हो गया बच्चों खत्म. Last drug we will start now is anticoagulants is finished. Last class of drug, then after this drug I will give you break. Okay, खुश हो जाओ. So antiplatelet, anticoagulant. Tell me third type of a drug which can lyse fibrin. Also known as thrombolytics. ठीक है, आ जाओ बच्चों. गुड. फर्स्ट पॉइंट क्या है फिब्रिनोलाइटिक? वी विल राइट दैट फिब्रिनोलाइटिक्स दे कैन डिसॉल्व अ क्लॉट और थ्रोम्बस. Okay, as the name implies. Let's see first normal physiology. How fibrinolysis occurs in our body. Normally, how fibrinolysis occur in our body. Sir, suppose this is a blood vessel and this is endothelial cell. And in this endothelial cell, suppose here fibrin is attached. F for fibrin. F for fibrin. समझ गए बच्चों? सर जब ये fibrin, when this fibrin becomes excessively deposited, I think we know it's a bad thing. Excessive deposition of fibrin will be a bad thing. So what will happen? There is a molecule in our blood. Let's call that molecule as plasminogen. Right now it is free. This plasminogen comes, I am writing P for plasminogen, it comes and attaches to fibrinogen. Let's call this plasminogen as bound plasminogen. Let's call this plasminogen as bound plasminogen. Debuji, I've told you why aspirin causes vitamin K deficiency. I've told you yesterday, aspirin also alters GIT flora. एस्पिरिन भी जीआईटी फ्लोरा को ऑल्टर करता है. वी डिस्कस yesterday when I was telling you warfarin. Now बच्चों, let's come back to here that this plasminogen is a protein which is free. When there is excessive deposition of fibrin, this plasminogen attaches and gets bound to fibrin. Now, when there is excessive fibrin deposition, these endothelial cells, they release one molecule known as TPA. Heard about this molecule TPA? Can you tell me the full form of TPA? I am writing here. TPA stands for tissue plasminogen activator. Now this TPA in our human body, it selectively converts bound plasminogen. In our body, it selectively converts bound plasminogen into active form known as plasmin. And this plasmin lies fibrin. और ये जब प्लाज्मिन एक्टिवेट हो जाता है, इट कॉजेस फिब्रिनोलाइसिस, ये फिब्रिन को डिग्रेड कर देता है. सो द प्रोडक्ट्स विच आर फॉर्म्ड आर नोन एज फिब्रिन degradation products. We call those products as fibrin degradation product, and one of the product is D-dimer. One of the product which is produced is D-dimer. So D-dimer is a type of fibrin degradation product which is produced after degradation of fibrin due to plasmin. But sir, tell me one point. I want to ask you one more thing. Go into more philosophical now. If there is overactivation of plasmin, what will happen? If there is overactivation of plasmin, what will happen? If there is overactivation of plasmin, what will happen? Tell me. Plasmin अगर ज्यादा बन गया तो क्या प्रॉब्लम हो जाएगी? Whole of this fibrin will be removed. And what can start? Sir, bleeding can start. Yes or no? If whole of this fibrin is removed by plasmin, this bleeding can start. So at some point, we have to prevent fibrinolysis. So अगर जब fibrin ज्यादा degrade होना शुरू हो जाता है, when this fibrin becomes excessively degraded, these endothelial cells, they release one molecule, PAI 1 and 2. PAI 1 and 2 is plasminogen activator inhibitor, and the function of PAI 1 and 2 is to inhibit TPA. ये TPA को फिर inhibit कर देता है. In our body, TPA activates bound plasminogen. But now I will tell you, when we make fibrinolytics as a drug, यहां पे गड़बड़ हो जाएगी. Lies fibrin degradation product known as, अरे यार डॉक्टरों की राइटिंग पहचानना शुरू करो यार अब तो. Although I have much better writing as compared to rest of the doctors, so try to, if you hear the words, you can easily identify the language. बेटा TPA एक्टिवेट करता है, PAI 1 and 2 इनहिबिट करता है. Plasminogen activator, who is activating plasminogen? TPA, and it is an inhibitor of TPA. तो plasminogen activator is TPA. Plasminogen activator inhibitor is a molecule which will inhibit TPA. ठीक है बच्चों? डन. आगे बढ़ते हैं. अब बात करते हैं. नो नीड टू रिमेंबर दिस स्टोरी. व्हाट यू हैव टू रिमेंबर इज ड्रग्स. सो लेट्स टॉक अबाउट fibrinolytics as a drug. Now what is their mechanism of action? Fibrinolytics as a drug, they activate plasminogen into plasmin. So when we discuss fibrinolytics as a drug, what is their mechanism? They activate plasminogen which is present in our body into plasmin. Okay. Okay. What is their route? They all are given IV only. IV only. What is their side effect? They may cause acute fatal bleeding And you will write they are very dangerous drugs. They are very dangerous drug because they can remove fibrin from any site of the body. हमारी बॉडी में मान के चलो ब्रेन में फिब्रिन डिपॉजिट है, नॉर्मल प्रोसेस है फिब्रिन डिपोजिशन होना, रिमूव हो गया स्ट्रोक हो जाएगा, पेशेंट कैन डाई सडनली विद इन मिनट्स. सो दीज ड्रग्स आर वेरी वेरी डेंजरस ड्रग. बिकॉज ऑफ दिस रीजन अभी मैं आपको बताऊंगा दे आर ओनली यूज्ड इन 2-3 conditions only. They are only used in very dangerous condition where the patient is going to die. Only then we will use fibrinolytics. Otherwise, we will not use fibrinolytics. But before that, let's see what are the drugs we have. So fibrinolytics as a drug, the first class of drug you will write is natural. So what are the drug? First is natural. And first drug you will write is streptokinase. Streptokinase. You'll write streptokinase is obtained from group C beta hemolytic streptococci. You know what is streptococci. Okay, you'll write its half-life is 80 minutes and it is given as a continuous IV infusion. Okay, the dose is 0.75 to 1.5 lakh international unit. Anything which is obtained from some natural source, we write a unit, international unit, per hour. Per hour. Drawback. Streptokinase is given once a lifetime. Reason: because their formation of auto antibodies. Do you agree with this point? Streptococci human में दे रहे हो, antibody बनेगी. Antibody will be produced. The next time when you will give streptokinase, what will happen? Effect will not come. Okay. Second drug we have made is urokinase. Urokinase is obtained from cultured human kidney cells. It is normally found in human urine also. It is found in human urine. You'll write half-life 15 minutes. Advantage: can be given in patients of, it is non-antigenic. It can be given in patients of previously treated with streptokinase. Previously treated with streptokinase. Now we have made recombinant human TPA. The second class of drug we have made is, beta, why you will give in post streptococcal infection? Why would you like to give in streptokinase in post streptococcal infection? Tell me the reason, Vishalji. No, it is why it should be given. Okay, recombinant human TPA. And these drugs will end with the word tiplase. These drugs will end with the word tiplase. Three drugs will write A, R, T. L-tiplase, retiplase, दे आर वेरी इंपॉर्टेंट बच्चों, इन पे एक क्वेश्चन हमेशा आता है, एवरी टाइम वन क्वेश्चन कम्स, टेनिक टिप प्लेस। ओके, तो टीपीए वर्ड इज कमिंग इन देम। ओके बच्चों, इफ यू आर गिविंग इन एम आई, यू डोंट हैव टाइम टू डू सेंसिटिविटी टेस्टिंग। एम आई हो रहा है, पेशेंट को मरने वाला है ना, स्ट्रोक हो रहा है, मरने वाला है, you will not have time for to do this, so we straight away give if there is some hypersensitivity occurs, we give corticosteroid to suppress that, है ना। Okay, now L tip place, red tip place and tenic tip place, let's write one point with them. L tip place is exactly human TPA. It is modified form. It is mutant TPA. Mutant means we have changed the amino acid sequence. Protein का sequence ही बदल दिया. Now you will write half life. It is the shortest acting drug, 8 minutes. Okay. You'll write 20 minutes half life, sorry 18 minutes, and here you will write 20 minutes. Now you will write that these two drugs, retiplase and tenecteplase, these are longer acting drugs. Because of this reason, they are known as, अभी आ रहे हैं मारिया जी, आपके क्वेश्चन पे ही आ रहे हैं, डोंट वरी मारिया जी, थोड़ा सा मारिया जी हमें वो रखना है, धैर्य रखना है जीवन में। नाउ दे आर नोन एज बोलस फिब्रिनोलाइटिक्स। आपके सारे सवालों के आंसर मिलेंगे आज, डोंट वरी, लेट मी फिनिश इट। बोलस फिब्रिनोलाइटिक्स। नाउ चलो बच्चों, पहला सवाल, टेल मी व्हाट इज द हाफ लाइफ ऑफ स्ट्रेप्टोकाइनेस। टेल मी द हाफ लाइफ ऑफ स्ट्रेप्टोकाइनेस, आई हैव टोल्ड यू। बताइए मारिया जी, आप ही बताइए, आपका क्वेश्चन है, आपको ही आंसर देंगे हम डायरेक्टली। मारिया जी, व्हाट इज द हाफ लाइफ ऑफ स्ट्रेप्टोकाइनेस? आई हैव टोल्ड यू, टेल मी द हाफ लाइफ ऑफ स्ट्रेप्टोकाइनेस। सी योर नोट्स एंड टेल मी। नोट्स देखो, बताओ सर। 80 मिनट्स, है ना। मतलब इफ यू थिंक लॉजिकली, स्ट्रेप्टोकाइनेस विल बी अ लॉन्गर एक्टिंग ड्रग। स्ट्रेप्टोकाइनेस विल बी अ लॉन्गर एक्टिंग ड्रग, यस सर, है ना। But if you see the half-life of retiplase and tenecteplase, it is less than streptokinase. It is less than streptokinase. But what I have written, it is even longer acting drug. Because as it is a longer acting drug, इसको continuous IV infusion से देने की जरूरत नहीं है. We need not to give these two drugs by continuous infusion. Unlike streptokinase, they are given as a only one injection and we can go back to our work. We will give one single IV injection and we can go back to our work. Now the question arises, why? Maria ji, ध्यान से सुनना. Why? Because these drugs are resistant to PAI 1 and 2. I hope now you know what is PAI 1 and 2. That is why I was telling you the physiology. These drugs are not degraded by PAI 1 and 2. They will remain attached on fibrin for plasmin for very long duration of time. Understood? So why? Because they are resistant to PAI 1 and 2 degradation. While streptokinase is degraded rapidly by PAI 1 and 2. PAI 1 and 2, you know, is plasminogen activator inhibitor. Last point you will write is that this tenecteplase, it is more specific for bound plasminogen. Don't you think it's a good thing? All other fibrinolytic, they activate bound plasminogen as well as free plasminogen. सर इसका मतलब क्या हुआ? सर फ्री प्लाज्मिनोजन कहीं और है, ब्रेन में है, बाउंड प्लाज्मिनोजन हार्ट में है. बाउंड प्लाज्मिनोजन को हमें हटाना है ताकि कोरोनरी आर्टरीज ओपन हो जाएं. व्हेन वी गिव ड्रग वी वांट दैट ओनली बाउंड प्लाज्मिनोजन should be activated, but these drugs they activate free plasminogen elsewhere in the body. And if plasminogen gets activated to plasmin, some other side of the body, it can remove fibrin from multiple sides of the body. It can start acute fatal internal bleeding anywhere in the body, and the patient may die suddenly on table. So that is why fibrinolytics, they can activate fibrin, plasminogen anywhere inside the body. They can start bleeding anywhere inside the body. Patient can die within minutes. I hope you have understood this point. Okay? अब बच्चों ये मत पूछो PAI 1 and 2 क्या है. I have already explained you what is PAI 1 and 2. Shiv Prasad ji, just see the notes. I have told you somewhere here PAI 1 and 2. लिखा भी था नाम इसका, ये कुछ लिखा था PAI 1 and 2. देखो एकता कपूर PAI 1 and 2. Okay? प्लाज्मिनोजन एक्टिवेटर इनहिबिटर. ओके बच्चों, भूलो मत, स्टोरी की तरह याद रखो. यस मारिया जी, यू आर एब्सोल्युटली राइट. नाउ लेट्स सी द यूजेस ऑफ fibrinolytics. Sir, they are very dangerous drug. Only 2-3 uses. The first use of those deadly diseases, stroke. पेशेंट मर जाता है सर, इसमें मर जाता है तो क्या करें? There are 2 types of stroke. Tell me, in which stroke you will not give? एक स्ट्रोक होता है ब्लीडिंग से, एक स्ट्रोक होता है ब्लॉकेज से. Tell me, in which stroke you will not give fibrinolytic, because fibrinolytic they themselves cause severe bleeding. You'll write fibrinolytics. गलती से भी सोचना भी नहीं है कि कभी भी हम हिमोरेजिक स्ट्रोक में देंगे. नेवर थिंक अबाउट इट. सर ऑलरेडी ब्लीडिंग इज अकरिंग, वुड यू लाइक टू गिव fibrinolytics? नहीं सर, दे themselves cause bleeding. So fibrinolytics are given in cases of ischemic stroke. Okay? So what is the timing of fibrinolytics in ischemic stroke? Sir, as early as possible. You'll write ideal time within 3 hours of ischemic stroke. पेशेंट को स्ट्रोक पड़ा, विद इन 3 hours आपने देना ही देना है. मैक्सिमम अप टू 4.5 hours. After 4.5 hours, there is no role of fibrinolytics in ischemic stroke because clot become resistant to degradation. दूसरी बीमारी, you'll write STEMI. I hope you remember the full form of STEMI. ST elevated MI. We give fibrinolytics. Okay? We give fibrinolytics only in ischemic stroke. Now here I will teach you the treatment of myocardial infarction. Yes, Vishal ji, it is safe to give, but the effect will be less of streptokinase. Now, before going further, now I want to tell you what is the treatment of MI. Sir, there is a condition known as acute coronary syndrome. There is a bimari with the name of acute coronary syndrome. Now what is acute coronary syndrome? In acute coronary syndrome, there is sudden blockage of coronary artery. There is sudden blockage of coronary artery. And for the treatment, we have to open this coronary artery and we have to maintain the blood perfusion again. The treatment is known as reperfusion therapy. So opening of coronary artery is also known as reperfusion therapy. समझ गए बात? Reperfusion therapy means opening of coronary artery. What is the ideal time? Ideal time is within 12 hours. Ideal time is within 12 hours. ठीक है? Understood this point? If a patient comes to you with some acute coronary syndrome, ideal time is within 12 hours. Now the question is, what do you mean by this word acute coronary syndrome? Sir, there is blockage of coronary artery. Because of this reason, blood supply is less. Let's see what can happen. A patient can present with 3 conditions. सबसे पहले कह सकते हैं, suppose this is the muscle of the heart. First, there will be ischemia. Known as unstable angina. So the first part of acute coronary syndrome is unstable angina. After that, there will be a small infarct. Small infarct means partial thickness infarct. छोटा सा infarct हो जाएगा. That partial thickness infarct is known as non-ST elevated MI. That partial thickness infarct is known as non-ST elevated MI. After that, sir, can we say there will be a full thickness infarct? Now there will be a full thickness infarct, transmural infarct. When there is a full thickness infarct, it is known as सबसे खतरनाक वाला ST elevated MI. ST elevated MI. I hope you have understood this. Acute coronary syndrome. First, there will be ischemia. Known as unstable angina. Then there will be a partial thickness infarct known as NSTEMI. Then there will be ST elevated MI, full thickness infarct. Yes. Now, what is the definitive treatment of MI? Open this coronary artery. Now, there are 2 methods of opening coronary artery. The first method of opening coronary artery is giving fibrinolytics. Okay. Second is PCI. Or you will write balloon angioplasty. Heard about this term? PCI stands for percutaneous coronary intervention. Percutaneous coronary intervention, what we do, we put a probe into coronary artery. यहां पे बलून होता है और बलून से इसे इन्फ्लेट करके हटा देते हैं. Percutaneous coronary intervention. Now the point is, can you tell me बच्चों, which is a safer option? नहीं बच्चों, ड्रेसलर सिंड्रोम अलग है, एक्यूट कोरोनरी सिंड्रोम अलग चीज है. नाउ कैन यू टेल मी विच इज सेफर ऑप्शन, fibrinolytics or balloon angioplasty? What do you think? Which is a safer option? Safer option is always and always PCI, percutaneous coronary intervention is a safer option. Now you will write, we don't give fibrinolytics here. We will only do PCI because the mortality of unstable angina and unSTEMI is very less. Fibrinolytics, they themselves can kill a patient. But in STEMI, जो सबसे dangerous है, in STEMI the mortality rates are very high. PCI will take time. Angioplasty करने में time लगता है. You cannot wait. Patient can die. So here you will do fibrinolytics and then you will plan for PCI. पहले fibrinolytics देंगे, streptokinase, and then we will plan for PCI. Now the question which came 15 days before in AIMS exam. Which of the following drug, question था, which of the following drug is not given in? Which of the following drug is not given in non-ST elevated MI? Which of the following drug is not given in NSTEMI? And the option was having streptokinase. Would you give streptokinase? Would you give streptokinase in non-ST elevated MI, NSTEMI or unstable angina? The answer is no. We don't give streptokinase or fibrinolytics in NSTEMI and unstable angina. I hope you have understood this concept. After PCI, we have written balloon angioplasty. एंजियोप्लास्टी वर्ड सुना है मेडिकल कॉलेजेस में? नहीं सुना, कोई बात नहीं, सुन लोगे. आई होप यू हैव अंडरस्टूड. डन. थर्ड यूज, यू विल राइट पल्मोनरी एम्बोलिज्म. आपका अब किशन जी इधर ध्यान देना. किशन जी ध्यान देना, आपका सवाल आ गया. पल्मोनरी एम्बोलिज्म. सर पल्मोनरी एम्बोलिज्म, लेग वेन, small emboli going into lungs, no problem. The drug of choice for pulmonary embolism is heparins, and you can maintain the patient on warfarin. The drug of choice for pulmonary embolism is heparin or warfarin. Now the question is, if the patient is having massive PE, सर बहुत सारे एम्बोलाई चले गए, इतने ज्यादा चले गए that right heart, there is right ventricular फेलियर में चला गया हार्ट, बिकॉज राइट पार्ट से ही ब्लड जाता है लंग्स में. पेशेंट इज गोइंग इनटू शॉक और हाइपोटेंशन. डोंट यू थिंक पेशेंट कैन डाई नाउ? Patient can die now. In this condition, you have to remove fibrin. Otherwise, we give heparin, which will prevent the further deposition of fibrin. Heparin का काम होता है इन फिब्रिन को डिपॉजिट ना होने दे. Fibrinolytics का काम होता है to degrade the fibrin which is already deposited. Here, in massive PE, the drug of choice is fibrinolytics. यहां पे आप स्टार्ट करोगे fibrinolytics. If the patient is going to die, only then you will start fibrinolytics. Yes, you can start any heparin, but we commonly give subcutaneous low molecular weight heparin, most commonly used. Because in pulmonary embolism, you have to give heparins for very long term basis. एक दिन नहीं चलता, कई दिनों तक चलता है, कई महीनों तक चलता है. Okay, you can give other oral anticoagulants also, like warfarin, apixaban, dabigatran. For long-term basis, you can start them as a maintenance drug. But if the patient is having massive PE, you will give fibrinolytics. If the patient is only having PE without any major symptom, you start the drug anticoagulant. Here you will start the drug fibrinolytics. Okay, done. You can use any heparin बच्चों, no problem with that, depending upon the patient. But we most commonly prefer subcutaneous. पेन नहीं होगा, मॉनिटरिंग नहीं करनी, बड़ा सा ड्रग वो नहीं लगाने की जरूरत, ड्रिप लगाने की जरूरत नहीं होगी आपको. All these things. Okay. Last point we will write now is antifibrinolytics. Also known as antithrombolytics. Sir, this is a very important point. Antifibrinolytics, they are considered as an antidote for fibrinolytics. They are antidote for fibrinolytics. Drugs Very important. You have to remember the names of these drugs. Remember a mnemonic: A, T, E. एप्रोटेनिन नहीं याद रहेगा, एप्रोटेनिन चलेगा, बट लास्ट टू ड्रग्स यू कैन नॉट अफोर्ड टू मिस. दीज ड्रग्स आर आस्क्ड एवरी ईयर: ट्रेनक्सामिक एसिड, एप्सिलॉन, अमाइनो, कैप्रोइक एसिड. शॉर्ट फॉर्म इज EACA. You cannot afford to forget these two drugs. This is very important for you. very important. इनको मत भूलिएगा, गलती से भी मत भूलिएगा इनका नाम. ठीक है, आई हैव टोल्ड यू दिस पॉइंट 3 times. ठीक है, इनके नाम नहीं भूलने: ट्रिनेक्सामिक एसिड, एप्सिलॉन एमिनो कैप्रोइक एसिड. Now these are antidote for fibrinolytics. So what is their mechanism of action? These drugs, they mimic antiplasmin 2. Hence they inhibit activation, they inhibit activation of plasminogen. Use: treatment of active internal bleeding and antidote for fibrinolytics. Antidote for fibrinolytics. है ना? Because fibrinolytics, they produce active internal bleeding. Any doubt in this? Why we have named it as antiplasmin? Because it is inhibiting plasminogen. हमारे ब्लड में एक और मॉलिक्यूल होता है एंटीप्लाज्मिन. एंटीप्लाज्मिन binds to plasminogen and directly inhibit the attachment of plasminogen on fibrin also. Okay, so this completes our blood part: antiplatelet, anticoagulants and fibrinolytics and antifibrinolytics. कहानी समझ आई सर? अंडरस्टूड द स्टोरी और नॉट? अच्छा, एक बार और बता दें रितु जी. कोई बात नहीं, एक बार और बताते हैं. सुनो रितु सिंह जी, सुनो. कोरोनरी आर्टरी ब्लॉक हो गई. सी योर नोट्स रितु, सी योर नोट्स एंड हियर व्हाट आई एम सेइंग. कोरोनरी आर्टरी हैज बीन ब्लॉक्ड. This is the muscle of the heart. Can we say first there will be ischemia? Yes. Ischemia is known as unstable angina. Then there will be a small damage of the tissue, partial thickness infarct. This is known as NSTEMI, non-ST elevated MI. Then there will be a full thickness infarct. This is known as STEMI, the most dangerous one. Now the point, I will tell you one medicine point. How you can distinguish them? सर इन तीनों को डिस्टिंग्विश कैसे करोगे? पेशेंट तो चेस्ट पेन से आएगा, सर दिल में दर्द हो रहा है, कैसे डिस्टिंग्विश करोगे? सर 2 टेस्ट करा लो, लिखिएगा मत, डोंट राइट दिस. एक ईसीजी करा लो, एक ट्रोपोनिन करा लो, कार्डियक बायोमार्कर्स करा लो, ट्रॉप्टी. इन अनस्टेबल एंजाइना एंड NSTEMI there will be ST depression. ST elevation होता है when there is transmural infarct, तब वोल्टेज में चेंजेस आते हैं. सेकेंड पॉइंट, बायोमार्कर. बायोमार्कर क्या होता है? सर व्हेन द हार्ट इज इन्फाक्ट हो जाता है तो ये ट्रोपोनिन, CPK, MB ब्लड में आने शुरू हो जाते हैं. So these proteins which are present inside the cell, they come into the blood when the heart undergoes infarction or damage. So it will be normal, increased. नॉर्मल, इंक्रीज. तीनों हो गए डिस्टिंग्विश, तीनों कर लिए डिस्टिंग्विश. whether it is unstable angina, whether it is NSTEMI और whether it is STEMI, इन दो टेस्ट के बेस पे तीनों को हमने डिस्टिंग्विश कर लिया. नाउ पेशेंट आया, क्या करें सर, अनस्टेबल एंजाइना और एनस्टेमी है, अभी प्लान फॉर पीसीआई, डोंट वरी, आराम से जाएंगे, पैर से femoral artery में we will put a catheter, from there we will reach to the coronary artery, when we will reach to the thrombus we will open a balloon, because unstable angina and NSTEMI are not very dangerous, mortality rates are less. फिब्रिनोलिटिक दोगे, कहीं ना कहीं ब्लीडिंग करा देंगे, दे विल रिमूव थ्रोम्बस इन कोरोनरी, बट दे विल स्टार्ट ब्लीडिंग समवेयर, पेशेंट में डाई ड्यू टू फिब्रिनोलिटिक, वी विल नॉट गिव फिब्रिनोलाइटिक. बट स्टेमी इज डेंजरस सर. Patient can go into ventricular fibrillation. Patient can have acute cardiac tamponade, ventricular aneurysm, sudden cardiac arrest. Patient can die within second. You don't have time for PCI. We will very rapidly start fibrinolytics. Okay? Done? Done. चलो. अभी बेटा है अभी time. So you want to take a break? You want to take a break? Yes. So after break, I will tell you now the main treatment of myocardial infarction. After the break, I will tell you treatment of myocardial infarction, acute coronary syndrome. Now this is a topic which is asked in your pharma. एक पेशेंट MI से आपके पास आया, आप उसे कैसे मैनेज करोगे, ठीक है, which drug to be given when. So let's talk about, let's take a break, and after break we will start with this. The break will be of 10 minutes. अभी आ रहे हैं बेटा उर्विक जी, स्टेटिन्स आएगा, अभी एस्पिरिन भी आएगा, क्लोपिडोग्रेल भी आएगा, स्ट्रेप्टोकाइनेज भी आएगा, बीटा ब्लॉकर भी आएगा. Whatever I am teaching you from past 2-3 classes, opioids, beta blockers or cardiovascular system, blood, now your past 3 classes summary we will make in this part after the break. ब्रेक के बाद अब सारी समरी बन जाएगी, जो अभी तक आपने पढ़ा है पिछली 3 क्लासेस में, that point we will be summarized now after the break. So let's take a break. Welcome back everyone. I hope you all are back now. I hope you all are back now. Yes or no? ऑडियो इज परफेक्ट. ऑडियो नहीं आ रही, एक मिनट चेक करते हैं ऑडियो आ रही है कि नहीं. आई थिंक ऑडियो इज कमिंग यार. ऑडियो इज कमिंग बच्चों. इन माई फोन इट्स कमिंग, आई डोंट नो व्हाई. Yeah, it's coming. Chalo, last point in CVS is myocardial infarction, heart attack, also known as heart attack. Let's see how do we manage myocardial infarction. Let's make a flow chart of it. First, you will write initial symptomatic treatment. That is MONA. Initial symptomatic treatment is MONA, but in different order we will write A for which antiplatelet drug? Aspirin. O for oxygen. My first question from you is बच्चों, which dose of aspirin you will give in acute attack of MI? Which dose of aspirin you will give in acute attack of MI? 75 or 325? 325 milligram orally. Easy. Followed by morphine. कुछ याद आ रहा है? मॉर्फिन, सॉरी, followed by nitroglycerin, NTG, followed by morphine. Yes, NTG 0.4 milligram sublingual, Morphine 2 to 4 milligram IV. Okay. Now in this treatment add other antiplatelet like कौन कौन से थे? क्लोपिडोग्रल, प्रासुग्रल, टिकाग्रिलोर. कौन से ड्रग्स थे सर ये? एडीपी रिसेप्टर ब्लॉकर. In this part add IV high molecular weight heparin. Why? The reason is, अगर आपने, if you will give aspirin like drug, what will happen? This thrombus can go आगे जा सकता है thrombus और आगे जाके block हो सकता है. This heparin is given only for 1 month continuously, that you don't have to write. Lastly, add high intensity statin therapy. अभी हम statins के बारे में बात करेंगे. Only 2 statins are approved. Atorvastatin and rosuvastatin. You have to remember the dose of statins. 80 milligram, 40 milligram. Why statins? Because statins reduce atherosclerosis. Atherosclerosis is the most common cause of MI in today's world. So this is initial symptomatic treatment. Now the patient is stabilized. After MI, remember MI से death नहीं होती. Death is because of complications of MI. Death is not because of MI. MI तो एक tissue damage हुआ. Death is because of complications of MI. So the second thing you have to do is manage complications which may arise. Manage complications. Now what are the complications? You will write first beta blockers. Drug of choice to prevent arrhythmias. And they decrease the risk of 40% mortality risk. अगर बीटा ब्लॉकर स्टार्ट करोगे ड्यूरिंग एमआई, देयर इज अ चांसेस ऑफ रिडक्शन ऑफ 40% को चांसेस ऑफ डेथ. सेकेंड पॉइंट, बीटा ब्लॉकर प्रिवेंट infarct expansion. Second drug, ACE inhibitor. ACE inhibitor also prevent infarct expansion. ठीक है. एटिनोलॉल, मिटोप्रोलॉल होते हैं ना बीटा ब्लॉकर. एस इनहिबिटर, एनालाप्रिल, लिसिनोप्रिल, यू नो. नेक्स्ट पॉइंट, थर्ड पॉइंट, इफ एरिथमिया हैज अकर्ड, द फर्स्ट कॉम्प्लिकेशन इज एरिथमिया. मैनेज दैट एरिथमिया. हाउ? इफ द पेशेंट इज हैविंग VF आफ्टर MI, टेल मी बच्चों द ड्रग ऑफ चॉइस. VF आफ्टर MI, ड्रग ऑफ चॉइस. आई एम गिविंग यू 2 ऑप्शंस, lignocaine or amiodarone. Which drug you will give? Which drug you will give? The drug of choice is now amiodarone. Earlier it was lignocaine. Earlier it was lignocaine. Second arrhythmia, SVT, atrial flutter and fibrillation. Sir, drug of choice. वराप्पा मिल। याद आ रही है बात? वेरी गुड, वराप्पा मिल। थर्ड कॉम्प्लिकेशन, द पेशेंट कैन गो इनटू कार्डियोजेनिक शॉक। Give IV fluids plus dobutamine or norepinephrine Remember norepinephrine when there is hypotension? Patient will have metabolic acidosis. Why metabolic acidosis occur? Sir, hypoxia causes acidosis. Give sodium bicarbonate. And if the patient is going into bradycardia, can you tell me which drug would you like to give? कोई भी कारण आ जाए ब्रेडिकार्डिया का, कौन सा ड्रग देते थे? एट्रोपिन. So these are the complication. Yes, now you know everything. Yes. Now you have prevented the complication. Third management, definitive treatment of MI. Open coronary arteries. The definitive treatment of MI is reperfusion therapy. Reperfusion therapy. Either fibrinolytics or PCI. Balloon angioplasty, then followed by stent placement. Okay. Fibrinolytics contraindicated in which type of MI? STEMI. पढ़ा था अभी हमने? Yes. After that, now you have stabilized the patient. Now you will discharge the patient. And after discharge of the patient, you will give certain drugs so that patient should not again have an attack of MI. So that kind of prevention is known as secondary prevention. Secondary prevention का मतलब, now we will discharge the patient and we will put the patient on certain drugs that will prevent the recurrence of MI. Okay. Now, tell me, first thing, beta blockers and ACE inhibitors. Why? Because they will prevent cardiac remodeling. MI के बाद heart failure हो सकता है, so they will prevent cardiac remodeling. Next, aspirin. In which dose? 75 milligram plus ADP receptor blocker, clopidogrel, prasugrel, etc. Antiplatelet drugs. Aspirin is given lifelong. Clopidogrel is given for 1 year. Don't have to write this part. Third, any other cause, statins. And lastly, lifestyle modification. सुट्टा पीना छोड़ दो, ज्यादा फैटी फूड अवॉइड करो, नमक खाना कम कर दो, salt, low salt diet, because salt causes hypertension. Hypertension will put stress on heart. So lifestyle modification. Okay. बेटा हमने सही लिखा है. You have written correct. I have written contraindicated in STEMI, but in other cases we give. So I hope you have understood now the treatment of MI. Okay. Why statins? For the treatment of dyslipidemia. Because excessive lipid level is the most common cause of atherosclerosis, which causes MI. I hope it's easy now. So let's start with the last topic of the blood. Let's start with the last topic of the blood, the drug which reduces lipid level. The drug which reduces lipid level are known as, next topic is hypolipidemic drugs. तो अब हम स्टेटिन्स वगैरह पढ़ेंगे. In NSTEMI we give beta, we don't give fibrinolytics in STEMI. अभी हम लिख चुके हैं ना, we have already made this part, है ना, we have already discussed reperfusion therapy. So there is no point of writing everything again. You already know that fibrinolytics are only given in unstable angina and NSTEMI. We don't give in STEMI, है ना? Oh, I'm really sorry. Yes. I'm really sorry for that. I'm really sorry. Yes, they are given in cases of STEMI. They are not given in cases of NSTEMI. Yes, you are right actually. Okay, yes, you are right. Yes, you are right. नहीं बेटा, वारफरिन नहीं देते. Yes. तो थोड़ा मैं भावुक हो गया था. I got emotional. So fibrinolytics, I get emotional with fibrinolytics. So remember, it's my weakness. Whenever fibrinolytics come, I get emotional, and emotional person always sometimes make wrong decisions also. So make it STEMI, okay? Done. चलो आगे बात करते हैं. आ जाओ बच्चों, लिखो hypolipidemic drugs. Yes. ठीक है? Now, what is hypolipidemic drug? These drugs, they lower blood lipid levels. Okay, they lower blood lipid levels. Hence, these drugs are given for the treatment of abnormal increase in lipid is known as dyslipidemia. Dyslipidemia is also known as hyperlipidemia. ये दो नाम होते हैं. One and the same thing. Dyslipidemia is also known as hyperlipidemia. Now. Okay. नहीं बेटा, भावना में नहीं, भावनाओं में बैठ के. ठीक है बच्चों, आगे बात करते हैं. Before starting drug, I will tell you a little bit about biochemistry part. Biochemistry में पढ़ते हैं ना हम lipid level. Remember बच्चों, there are two types of lipid in our body. There are two types of lipid in our body. One is straight chain lipid, like this. This lipid is known as triglycerides. TG stands for triglyceride. And second type of lipid is like this, circle type. It is known as cholesterol. So these drugs, they decrease the level of triglyceride and cholesterol. Okay. Now the question arises, sir, if the level of cholesterol is high, what it can lead to? Remember, level of cholesterol, if it is high, it leads to atherosclerosis. And atherosclerosis leads to blockage of blood vessels. And this atherosclerosis leads to MI and stroke. So can we say that hypolipidemic drugs which reduce cholesterol level are used for the treatment of MI and stroke? Yes, very good. Sir, any one of the following from any one of you can tell me that if triglyceride levels are high, what complication it can lead to? Sir, triglyceride, why they are bad? Any one of you can tell me the answer. In which disease high level of triglyceride leads to complication of the, मतलब triglyceride से क्या problem आती है? Remember, increase in level of triglyceride causes one disease known as acute pancreatitis, which is a very dangerous disease. Increase in level of triglyceride causes pancreatic damage. Hence, if the patient has a very high level of triglycerides, we give hypolipidemic drug to prevent acute pancreatitis. तो ये बात फिलहाल आपने याद रखनी है. Now the point you have to remember is, first point, let's talk about physiology of this lipids. Physiology. Now fatty liver is not a problem. Now I want to ask you one thing now, that these lipids, they are fatty molecule. Yes, we know. And fat, they are not able, they cannot dissolve in water. We know that blood is a watery media. Remember, to transport this lipid, we need help of certain proteins known as lipoproteins. We need the help of certain proteins known as lipoproteins. So, to transport lipid in blood, lymph, which is a watery media, we need lipoproteins. Now, what are the lipoproteins we have? That I will tell you shortly. Okay? Now I will tell you shortly. Suppose, sir, you went to Domino's and you ordered a cheese burst pizza. यार वो तो करना ही है, डाइट रिस्ट्रिक्शन तो करना ही है, बट पेशेंट मानता कहाँ है. ठीक है. सपोज यू वेंट टू डोमिनोज, यू ऑर्डर्ड अ चीज बर्स्ट पिज्जा, एंड दैट चीज बर्स्ट पिज्जा contains a lot of triglyceride and cholesterol. I am using this word, triglyceride and cholesterol. Short form I am using. Okay, I hope you are comfortable with this short form now. Triglyceride and cholesterol. Now, these triglyceride and cholesterol, first they come into, from GIT, they come into lymph. Lymph is also a watery media just like blood without RBC. And in lymph, they are transported with the help of chylomicrons. They are transported with the help of chylomicron. Question comes, chylomicron transport which lipid? Chylomicron transport both dietary lipids, triglyceride and cholesterol. Which organs synthesize chylomicron? Intestine synthesize chylomicron. We know this part. Now, this chylomicron goes to liver. Now, this is the function of chylomicron, to transport dietary lipids to liver. Now, from liver, we know blood is there. Liver takes up this chylomicron, and now blood is the main transport media of our body. Liver secretes VLDL. Liver secretes VLDL. I hope you know what is VLDL. Very low density lipoprotein. VLDL also transports triglyceride and cholesterol. VLDL also contains triglyceride and cholesterol. Now, sir, you know that in our blood vessels we have endothelial cells. In our blood vessel we have endothelial cells, and on the surface of endothelial cells we have one enzyme, lipoprotein lipase. Let's write that enzyme as LPL enzyme. What is the function of lipoprotein lipase enzyme? Lipoprotein lipase enzymes removes triglycerides from lipoprotein. It removes triglyceride from lipoprotein. Because of this reason, VLDL gets converted into IDL, intermediate density lipoprotein. IDL contains less of triglyceride, more of cholesterol. Less of triglyceride, more of cholesterol. And finally, what is produced is LDL. LDL stands for low density lipoprotein, and low density lipoprotein contains only and only cholesterol. It contains only and only cholesterol. समझ आ गई बात? मुश्किल है ये? Do you think it's difficult? Do you think it's difficult? No, it's very easy. So if our body cells, they need triglyceride, we have lipoprotein lipase enzyme. Okay. We have lipoprotein lipase enzyme. But if our body cells, they require cholesterol. Cholesterol is also required for cell membrane, hormone synthesis. Remember, the cholesterol donating species is LDL. Our body cells have LDL receptors. And LDL donates cholesterol. So LDL is the main species which donate cholesterol. Now the point is, all these lipids what we have written, they are bad lipids. Don't you think if the level of, let's say, LDL is very high in our body, अगर LDL बहुत ज्यादा है सर, तो क्या होगा? Don't you think this cholesterol will be deposited in abnormal sites also? Let's say below the blood vessel only. And high level of LDL can lead to atherosclerosis. High level of LDL will lead to atherosclerosis. Yes or no? So these lipids are known as bad lipids. High level of VLDL can lead to acute pancreatitis and atherosclerosis. High level of LDL will lead to atherosclerosis. Yes. Now we have a very good lipid. That good lipid is HDL. Because HDL remove cholesterol from abnormal site. HDL removes cholesterol from abnormal site. So the level of HDL is high in your body. It means you will have less chances of atherosclerosis. Yes. What is the function of HDL? This HDL donates its cholesterol. It donates its cholesterol back to HDL. So it will transfer its cholesterol back to LDL with the help of one enzyme CETP. With the help of one enzyme CETP. Let's name this enzyme as, I will tell you the full form of this enzyme later on, cholesterol ester transfer protein. Cholesterol ester transfer protein. Done. And when this LDL, IDL, VLDL, they will get cholesterol back, this LDL will be removed by the liver. This LDL will be reuptaken by the liver. And the cycle will be completed. Can we say that HDL indirectly reduces LDL level? HDL से LDL का level कम होता है. HDL reduce LDL level. So HDL is a good lipid. खत्म आ गई बात. If you have understood this simple physiology, rest of the drugs are very simple now for you. ठीक है, अब ड्रग्स बड़े सिंपल है. So let's write drugs, hypolipidemic drugs. बच्चों ये तो पढ़ लो पहले, नेक्स्ट टॉपिक के बारे में मत टेंशन लो यार, वो भी करा देंगे। पहले ये तो पढ़ लो, यही भूल जाओगे तो नेक्स्ट टॉपिक में क्या करोगे? फोकस, फोकस इज वेरी इंपॉर्टेंट यार। करवा देंगे यार, सब चीजें करवा देंगे, क्यों परेशान हो रहे हो यार? इतनी छोटी छोटी बातों पे परेशान होगे तो जीवन कैसे जियोगे? सर ये करा दो, वो करा दो, सब होगा ही यार। वाई वाई टेकिंग बेकार का स्ट्रेस एंड ऑल, वी विल डू, डोंट वरी। ठीक है, ओके। सो hypolipidemic drug. So first we will write the list of the drug. First you will write HMG CoA reductase inhibitor. Drugs are known as statins. Drugs are known as statins. Second, bile acid binders, also known as sequestrants. Bile acid sequestrant, what is that? I will tell you. These drugs are known as resins. Third, lipoprotein lipase activators. These drugs are known as fibrates. Lastly, one vitamin. Which vitamin is used as hypolipidemic drug? Which vitamin is used as a hypolipidemic drug? Niacin. Which vitamin is used as a hypolipidemic drug? Niacin. ठीक है बच्चों? After that, I will tell you new drugs. After that, I will tell you new drugs. समझ गए बच्चों? First right. Now, you will leave this page for comparison of these drugs. And this page we will fill at the last. इसको हम last में fill करेंगे. After understanding all drugs, we will compare these drugs. Okay? We will compare after that. थोड़ा सा स्पेस छोड़ देंगे, बाद में कंपेयर करेंगे ये सारे के सारे. ठीक है? We will compare this after a while. ठीक है? So we will leave a space for comparison. We'll make a summary afterward. Let's start with the first drug, statins. आधा पेज छोड़ दो यार, आधा पेज छोड़ दो. चलो, कितना छोड़ना है लिख लीजिए, लिख लीजिए. अगर आपको कितना छोड़ना है देखना है तो यहां पे लिखोगे स्टेटिन, रेजिन, फिब्रेट, नियासिन. ठीक है? यहां पे लिखोगे तीन चीजें, सॉरी चार चीजें. लिखोगे LDL-C, ट्राइग्लिसराइड, HDL. यहां पे एनी स्पेशल पॉइंट विल बी देयर, आई विल टेल यू. ठीक है? So we will fill this diagram later on. ठीक है? So this is the comparison we will make. Right now you will not understand this part. Let's understand first what is statins. Let's understand what is statins. Done? Now, mechanism of action. Statins, they inhibit de novo cholesterol, CH stand for cholesterol synthesis in liver. Statins, they inhibit de novo synthesis of cholesterol in liver. Remember, cholesterol we don't have a source of cholesterol just from pizza only or diet only. Liver itself can also synthesize cholesterol. Liver itself can synthesize cholesterol. How? Liver synthesizes cholesterol with the help of an enzyme. I'll tell you. HMG-CoA. And this HMG-CoA, first step gets converted into mevalonate. And through mevalonate, cholesterol is produced. Now this first step you will write is the rate limiting step. This first step is the rate limiting step of cholesterol synthesis. After niacin, we have written new drugs. Okay? And this step is carried out by HMG-CoA reductase. Reductase word is also very important. Okay? So, statins, you will write, they competitively inhibit HMG-CoA reductase. This is a very commonly asked question. Statins, they inhibit this enzyme. Statins, they inhibit which enzyme? HMG-CoA reductase enzyme. Done? Now what will happen? Can we say cholesterol level in the liver will decrease? Liver में cholesterol का level कम हो जाएगा. Yes, level of cholesterol in liver will reduce. Now tell me, if liver needs cholesterol, if liver needs cholesterol from the blood, it will now take cholesterol from the blood. Can you tell me which is the only lipoprotein which can donate cholesterol to body cells? Can you tell me which lipoprotein donates cholesterol to the body cells? कौन सा lipoprotein कोलेस्ट्रॉल डोनेट करता है बॉडी सेल्स को? That lipoprotein is LDL. Yes. So, because of this reason, what will happen? This will lead to increase LDL receptors on liver. It will increase LDL receptors on liver, and because of this reason, there will be LDL uptake from blood. Because of this reason, there will be decrease in blood LDL level. Because liver cannot synthesize cholesterol, now it will take LDL from the blood. The LDL receptors on liver will increase. है ना? समझ गए कहानी? Is it simple or not? Is it simple or not? Yes, it's simple. I am assuming it's simple now. Okay? चलो आगे बात करते हैं. Okay? Done? Next point, what are the drugs? Drugs you will write LPF, SARP, lovastatin, pravastatin, fluvastatin, I am using S words for statin. Simvastatin, atorvastatin, rosuvastatin, and pitavastatin. Pitavastatin. अभी आएंगे बेटा. यस, HDL का लेवल ये बढ़ाएगा. आई विल टेल यू दैट पॉइंट शॉर्टली. डन. नाउ इफ यू टॉक अबाउट पोटेंसी or dose, you'll write least potent. Why it requires maximum dose? Most potent. Statin is pitavastatin. Most potent statin is pitavastatin. अर्का जी अभी सब पे आएंगे. माजुमदार अर्का माजुमदार जी इवोलो क्यूमैप पे भी आएंगे. बहुत मजा आएगा उसमें. अभी इस पे ध्यान दीजिए. विच इज द मोस्ट पोटेंट स्टेटिन? पिटावास्टेटिन. ओके. विच इज द मोस्ट एफिकेशियस स्टेटिन? एफिकेसी मीन्स इफेक्ट irrespective of dose. Efficacy. Efficacy means how much LDL they will decrease. How much LDL they will decrease? You will write that all statins can decrease LDL up to 50%. But there are two statins which can decrease LDL by more than 50%. There are only two statins which can decrease LDL by more than 50%. These statins are known as high intensity statin therapy. And those two statins are rosuvastatin and atorvastatin. Only these two statins can reduce LDL by more than 50%. So tell me, which is the most efficacious statin? सबसे ज्यादा इफेक्टिव कौन से हैं? मार्केट में जाओगे यही मिलेंगे और कोई नहीं मिलेगा ज्यादातर. रोजुवा एंड एटोरवा. But are they most potent statin? No. Most potent will be pitavastatin. Done. What is the dose? कुछ याद आ रहा है? कुछ याद आ रहा है? कहीं लिखा था? Now, because of this reason, we will write what is the indication for high intensity statin therapy. In which condition we want to reduce LDL very, बहुत ज्यादा LDL हमें कब कम करना है? What is the indication? Yes, the first indication is we all of us already know if the patient is having MI or stroke. If the patient is having MI and stroke, Sachin beta, potency means dose required to produce 50% of effect. Okay. Okay. Second, when the LDL level is more than 190. What is target LDL? Target LDL should be less than 100. So only these two statins can reduce more than 50%. And lastly, you will write, if the patient is having LDL 130 to 160, but the patient is also having डायबिटीज मेलाइटस, पेशेंट को साथ में डायबिटीज है, एलडीएल कम है, बट साथ में डायबिटीज और हो गई है, डायबिटीज इज एन इंडिपेंडेंट रिस्क फैक्टर फॉर एथेरोस्क्लेरोसिस, यू विल गिव हाई इंटेंसिटी स्टेटिन थेरेपी. So this is a question of medicine also, pharma also. In which patient you will give the maximum, this high dose of statin, Rosuva 40, Atorva 80 in this case. Got it? Very good. Let's write certain properties. Let's write certain properties of statins. First point, longest statin. Again we will write Rosuva. Second is Atorva. Because of their longest duration of action, they are the most efficacious. What is the importance of this point? These two statins we will write can be taken any time during day. Rest all other drugs they are taken before sleeping. इसको हम लिखते हैं HS. We write like this, HS. Take a drug before sleep. The reason is maximum cholesterol synthesis in our body takes place around 1 AM to 2 PM. रात को 12 बजे के बाद कोलेस्ट्रॉल सिंथेसिस हमारी बॉडी में ज्यादा होती है. तो give statin when the cholesterol synthesis is maximum. They will have maximum effect. ओके सॉरी 190 तक कर दो, सॉरी 130 टू 190 कर दो, 160 भी लिख सकते हो. ओके आई एम सॉरी फॉर दैट, बट दैट इज नॉट इंपॉर्टेंट, दैट इज नॉट वेरी इंपॉर्टेंट पॉइंट. ओके सो सम स्टूडेंट्स हैव ऑलरेडी अटेंडेड माय क्लास आई थिंक अर्लियर, so they are pointing out the mistakes now. Prodrugs, lovastatin and simvastatin. Next point, statins are metabolized by CYP3A4 in liver. All statins are metabolized by CYP3A4 in liver except rosuvastatin, pravastatin, no CYP. Fluvastatin, CYP 2C9, warfarin wala sir, warfarin wala. This question has been asked many times. This question has been asked many times. Rosu and Prava, no CYP, very commonly asked question. Okay, they all are the members of a family CYP 450. So these are the different types of CYP enzymes you will learn in general pharma. Done bachcho. Next point, statins, they are contraindicated in pregnancy. Absolutely. And they are contraindicated before puberty. Before puberty means बच्चों में, children less than 12 years of age. You will write except, growth hamper हो जाती है उनकी. Pravastatin. Pravastatin puberty से पहले दे सकते हो, but you will write Pravastatin is contraindicated in less than 8 years of age. But that means Pravastatin can be given in children for 8 to 12 years of age also. Done. Last point with statin you will write is pleiotropic effects of statins. Pleiotropic means many beneficial effects of statin. Apart from decreasing lipid level or LDL level. Apart from decreasing LDL level, statins have many other beneficial effects. Sir, why? Remember your biochemistry. Sir, ये जो मेवालोनेट होता है ना, ये बड़ा गंदा मॉलिक्यूल है, very bad molecule, mevalonate. Mevalonate is a very bad molecule. Mevalonate causes inflammation in our body. So, statins are anti-inflammatory. Mevalonate causes coagulation. उस पे प्लेटलेट वगैरह प्रोकोगुलेंट इफेक्ट होता है उसका. Statins they have anti-coagulant effect. Why? Because they decrease fibrin level in the body. They decrease plasma fibrin level in the body because atherosclerosis में fibrin deposit हो जाता है. Remember, atherosclerosis is not just deposition of cholesterol. In atherosclerosis, there is chronic inflammation which is occurring, and chronic inflammation is damaging cells, endothelial cells. So you will write it improves endothelial function. Lastly, you will write statins, they decrease uric acid level in blood. Because in inflammation, when the cell dies, DNA gets damaged. DNA goes to the liver. Uric acid is produced. Uric acid is increased during inflammation. It's an inflammatory marker. Or atherosclerosis is inflammation. Now you will write maximum rosuvastatin, maximum pravastatin. ठीक है, maximum pravastatin. Okay, they are not metabolized, they are excreted just like this. Rosua excreted just like this in urine. No need of changing the drug. Last point, side effects of statin. Very, very important. Bachcho, make all these things opposite. Make all this thing opposite in atherosclerosis. In atherosclerosis, inflammation increases. It's a chronic inflammatory condition. Endothelial damages, platelets and fibrin can attach, blockage of blood vessel leading to MI. है ना, इसीलिए होता है ना. So make everything opposite during inflammation in atherosclerosis. Atherosclerosis में सारी चीजें उल्टी हो जाती हैं. ठीक है. Now side effect. First, although they are very safe drug, but we will write two rare side effects of statin. They are very important. First, hepatotoxic. Okay. Second one, myopathy. Now, please remember this word myopathy. It causes muscle damage. So, initially there will be pain, but later on it can lead to degeneration. Degeneration of skeletal muscle is known as rhabdomyolysis. Degeneration of skeletal muscle is known as rhabdomyolysis. It is a very, very dangerous condition. Patient can die in rhabdomyolysis. Why? Because in rhabdomyolysis, there is myoglobin which comes into the blood, and this myoglobin causes cola colored urine. And when this myoglobin goes out through the kidney, it causes kidney damage and the patient may die because of acute renal failure. Acute renal failure. So, the question which comes very commonly, what increases the risk of myopathy due to statin? This is a very repetitive question. What is the risk factor? What are the conditions in which there is increase in risk of myopathy due to statins? You will write the first risk is when we combine statin with other hypolipidemic drug. And just write two drugs. One is gemfibrozil. We never combine statin with gemfibrozil. Second, you will write niacin. Other hypolipidemic drug when combined with statins increase the risk of myopathy. Second point, when statins are combined with enzyme inhibitor. Remember enzyme inhibitor? Coke IVC, cimetidine, omeprazole, ketoconazole, erythromycin. Full list is in general pharma, and with as erythromycin you will write clarithromycin. And please mark this word erythro and clarithro. Sir, 10 days before, in June 2020, question came. There is a patient on statin. Which of the following drugs should not be combined with statin? Otherwise, there will be increase in risk of myopathy. The option was having clarithromycin. 1 year before, the option was having erythromycin. Okay. Beta, these side effects are very rare, not very common. These side effects are very rare, not very common. कोई बात नहीं. These side effects are very rare. Black हो गया. Don't worry, आ रहा है. Black हो गया. No problem. Don't worry, we are coming back. कोई बात नहीं यार. Okay. Okay. Orange is the new black, है ना? Yeah. Coming back, don't worry. डन हो गया. Just wait for a second. Done? Chalo. Okay, so I think done. Chalo. Okay, now we can resume. Let's write the other risk factor for myopathy. Write old age, female sex, okay, high statin dose, lastly, liver or renal disease. These are the certain other factors which can increase the risk of statin. बेटा ये आया था एम्स में क्वेश्चन. Which drug should not be combined with statin, otherwise it will increase the risk of myopathy. Enzyme inhibitor दोगे, CYP inhibit हो जाएगा, statin metabolize नहीं होंगे. If statins will not get metabolized, their level will increase, they will increase the risk of myopathy. Simple as that. Erythromycin was asked previous year. This year clarithromycin was asked. Done. Uses of statin. So you'll write statins. Among all hypolipidemic drugs, it causes maximum decrease in LDL level. Among all drugs, statins, they cause maximum decrease in LDL level. Hence, statins, they are the drug of choice for hypercholesteremia. You know that LDL carries cholesterol. Now, what are the causes of hypercholesteremia? We will write that part. Cholesterol का level कब बढ़ जाता है? You will write familial causes and acquired causes. Familial means genetic disease. You'll just write one point in familial type 2 and type 5. There is increase in LDL level. So here the drug of choice is statin. In familial 2 and 5, what is 2, 5? I will tell you in the last. Can you tell me certain acquired causes? Yes, acquired causes is, we will write metabolic syndrome, हमारा lifestyle, छोले भटूरे, पनीर टिक्का, बटर चिकन, चीज बस्ट पिज्जा, है ना, पूड़ी आलू, दम बिरयानी, है ना, with lot of ghee. Metabolic syndrome, nephrotic syndrome. In nephrotic syndrome, there is increase in cholesterol level. Sir, drug induced. Can you tell me 2-3 drugs which increases cholesterol level? Yes. Which diuretic? Thiazides. Loop diuretics. They increase cholesterol level. हमने पढ़ा था LDL level. Yes. The only solution to prevent myopathy is reduce the dose of statin. KFC, yes. So this is the most important drug, statins, which we have done. Let's talk about now the other drugs, not in very detail we have to learn. Statins we have to learn in great detail. So let's talk about, हाँ लॉकडाउन में सभी का मेटाबॉलिक सिंड्रोम तो हो ही गया. In lockdown we are all suffering from metabolic syndrome. Reasons. Now what are reasons? Let's understand. Sir, suppose this is GIT and this is liver. Liver is secreting bile. Bile contains cholesterol. Bile contains cholesterol. But 95% of this bile goes back to the liver. This cycle is known as entero, means intestine. From intestine to liver, the bile will go. This is known as enterohepatic reabsorption of bile. As simple as that, we all know this part. What are resins? Their mechanism of action. Resins, they are bile acid binders or sequestrant. Sequestrant means they will bind to bile. When you will give resins, they will bind to bile and the bile will be excreted in feces. Because of this reason, they will prevent enterohepatic reabsorption. They will prevent enterohepatic reabsorption of bile. Yes or no? They will prevent enterohepatic reabsorption of bile. Bachcho, I want to ask you one thing. Tell me the answer. Tell me the answer. I want to ask you one thing. Liver is not getting cholesterol from bile. If liver now needs cholesterol, what will happen? The only cholesterol donating species will be LDL. Liver is now not getting cholesterol from bile. Now liver will acquire bile from the blood. It will increase LDL receptors on liver. And it will decrease blood LDL level. Yes. Okay. LDL level. Okay. Now, what are the drugs? These drugs, they will start with the word chol. Cholestyramine, cholestyramine, cholestipol, and cholesevalum. Call word will come. Okay. Yes, diabetes can lead to type 2 diabetes leads to hyperlipidemia. Type 2 diabetes. Okay. Now, these two molecules are available as a powder form, and this is available as a tablet. Okay. Now, uses. Add on to statin to decrease lipid level. Second, they are the drug of choice as hypolipidemic drug in pregnancy. In pregnancy, no other hypolipidemic drugs we give. If you want to reduce lipid level in pregnancy, the only drug we have is raisin, because raisins, when you give orally, they are not absorbed into the blood. They will just bind to bile and they are excreted out of the body. So what is the drug of choice in pregnancy? Raisins, because they are not absorbed in blood. Okay. Lastly, they are also given for pruritus in liver failure, because pruritus in liver failure is because of continuous absorption of bile, and bile is not degraded by the liver. Okay. Cholecebulum, you will write, is also approved in type 2 diabetes mellitus, because type 2 diabetes mellitus is a part of metabolic syndrome. I will tell you in diabetes. Side effect: GIT upset like steatorrhea, flatulence, etc. Lastly, they decrease absorption of certain drugs which are dependent upon bile. Yes, they are the drug of choice for reducing blood lipid level in pregnancy. Now, they decrease absorption of drug. Just remember two drugs. Digoxin. Second, you will write thyroxine. There is a huge list, but try to remember only these two drugs. Digoxin, thyroxine. Okay. Third class of drug is fibrates. Third class of drug is fibrates. Mechanism of action: fibrates are PPAR alpha agonist. Okay. Hypolipidemic drugs in pregnancy. If there is hyperlipidemia in pregnancy, then you will give which hypolipidemic drug? Raisin. Now what is PPAR alpha? We will write peroxisomal proliferator activating receptor alpha. Now sir, what is this? Sir, as you can see, this word PPAR, peroxisomal proliferator activating receptor, बड़ा लंबा सा नाम है. This is a nuclear receptor. Specially present in endothelial cells. It's a nuclear receptor present in endothelial cells. Now, suppose sir this is a blood vessel and this is an endothelial cells. And this endothelial cell has PPAR alpha receptor. Sir, when you stimulate this receptor by fibrate, which stimulate PPAR receptor, alpha receptor in endothelial cell, this endothelial cells will start producing one protein, LPL enzyme or LPL protein. This activation of this receptor leads to increase in LPL. I hope you know the full form of LPL. Lipoprotein lipase. Lipoprotein lipase enzyme. Yes. Now my question from you people is, you students is, lipoprotein lipase mainly reduce cholesterol और ट्राइग्लिसराइड. लाइपोप्रोटीन लाइपेस किसको डिग्रेड करता है? कोलेस्ट्रॉल और ट्राइग्लिसराइड. इट रिमूव्स ट्राइग्लिसराइड फ्रॉम द ब्लड. बिकॉज ऑफ दिस रीजन fibrates they decrease triglyceride level in blood. Among all drugs maximum. ठीक है बच्चों, यहां पे हम पीपीआर अल्फा पढ़ रहे हैं. डायबिटीज में हम पीपीआर गामा पढ़ेंगे अभी. हियर वी आर डिस्कसिंग अल्फा. कैन यू टेल मी डिक्रीज इन ट्राइग्लिसराइड लेवल? कैन यू टेल मी देयर इंडिकेशन ऑफ यूजेज? Their indication is if the patient is having high risk of acute pancreatitis, we give this drug. Now the point is, what are the uses of fibrates? You'll write hypertriglyceridemia. Hypertriglyceridemia when triglyceride level is more than 500. We start fibrate. When the level of triglyceride is more than 500, we start fibrate, because at this level there is a risk of acute pancreatitis. Let's see the causes of hypertriglyceridemia. First is familial. You'll write familial type 3 and type 4. स्टेटेंस के साथ क्या लिखा था सर? 2 और 5. This familial type 3 is also known as अभी हम इसके बारे में बात करेंगे, बीटा लाइपोप्रोटीनीमिया. Beta lipoproteinemia. Remember this word, question comes. Acquired. One of the most important or acquired cause of increase in triglyceride level is alcohol, daru. One of the most important cause of increase in triglyceride level is daru, alcohol. Done. Let's see what are the drugs. The first fibrate which we made was clofibrate. Very easy to remember, fibrate word is coming. Then we made fenofibrate. Very easy to remember, fibrate word is coming. Bezafibrate, again fibrate word is coming, very easy to remember. Lastly, gemfibrozil. Fibro word is coming, very easy to remember. Maria ji, we will discuss familial hyperlipidemia in the last. I will compare all drugs in the last. But first you need to understand this drug. है ना बच्चों, पहले समझना भी जरूरी है. Clofibrate has been banned now, not used, because clofibrate was increasing LDL level. And you know, LDL causes MI and stroke. LDL causes MI, stroke. So this is not used now. Okay. Fenofibrate, you will write no CYP interaction. And it also decreases uric acid level. Just like statin. Just like statin. Gemfibrozil is a CYP inhibitor. Never combined with statin. Can you tell me the reason why? Why gemfibrozil should not be combined with statin? Can you tell me why gemfibrozil should not be combined with statin? Because it will increase the risk of which condition? Myopathy. It will increase the risk of myopathy. Okay, it will increase the risk of myopathy. Done. Now, can you tell me the best drug to be combined with statin? Best drug, which fibrate would you like to combine with statin? The best fibrate you will combine with statin is fenofibrate. The best fibrate you will combine with statin is fenofibrate. And when you will go into the market, you will get either atorvastatin with fenofibrate or you will get rosuvastatin with fenofibrate. Atorva और rosuva वहां से उठा लेंगे, यहां से fenofibrate उठा लेंगे. ठीक है. Last point is, you will write, these drugs you'll write are given with food. Because food increases absorption. Fibrates are given with food. This is how you will write. Fibrates are given with food. Side effect. They themselves can cause myopathy and they can cause gallstones. Okay. And they can cause gallstones. The reason is increase in LDL level. LDL contain cholesterol. Cholesterol causes cholesterol, है ना? Cholesterol stones होते हैं ना gall bladder में? Yes. Next drug, last drug is niacin. Which vitamin is used as a hypolipidemic drug? Niacin. नियासिन. ओ नियासिन, आते हैं नियासिन पे. नियासिन is also known as nicotinic acid. Okay, you will write, we use very high dose as hypolipidemic drug. Around 2 to 5 grams. 2 to 5 grams. Remember, when you give vitamin B3, niacin, it requires dose in micrograms. The vitamin dose of niacin is in microgram. Remember, when you give niacin in very high dose, it becomes totally different drug. Now it is not a vitamin. In very high dose, niacin is not a vitamin. In a very high dose, niacin reduces lipid level. How? It has direct action or direct receptors on liver and adipose tissue. It has direct action on liver. In liver, you will write, it decreases triglyceride synthesis. It increases HDL level. ब्रैकेट में लिखोगे मैक्सिमम, and it is the only drug among hypolipidemic drug which can decrease lipoprotein A level. Lipoprotein A is synthesized during atherosclerosis. It is a modified form of LDL. अगर ब्लड में लाइपोप्रोटीन ए मिल गया, ए का मतलब एथेरोस्क्लेरोसिस हो रहा है. डन. And in adipose tissue, it inhibit lipolysis, which also decreases triglyceride level. Okay. Use. Niacin is given in resistant cases. Okay. In resistant cases with statins to increase HDL level, with fibrates to decrease triglyceride level. Okay, to decrease triglyceride level. Last point is niacin side effect. You'll write niacin is the most toxic drug. Let's write the side effect. First is flushing, itching. Flushing or itching. Flushing is the most common side effect of niacin. Flushing or itching. Spelling ठीक कर लेना itching की. Why? Reason. Niacin increases prostaglandin D2 level. Prostaglandin D2 act as a vasodilator and it also causes itching. So what is the treatment? Treatment of niacin induced flushing is aspirin. Because aspirin decreases PGD2 synthesis. Second, laropiprant. Prostaglandin D2. PR मतलब prostaglandin ANT means receptor antagonist. Prostaglandin receptor antagonist. These two questions have been asked. Other side effect. Hepatotoxic. Third, hyperuricemia. Fourth, hyperpigmentation. Now I will tell you the reason for this. Okay. Sir, it is the most hepatotoxic drug among hypolipidemic. Because of this reason, we don't use niacin as a much drug. Now my question from you people is, which hypolipidemic drug reduces uric acid level? Statin, fibrate. They were decreasing uric acid level. Niacin increases uric acid level. This question has been asked many times. Which hypolipidemic drug increases uric acid level? Niacin. Hence should not be given in gout people. Gout में कौन सा ड्रग नहीं दोगे? नियासिन नहीं दोगे, स्टेटिन्स दोगे. ठीक है. Why hyperpigmentation? Because niacin is required for melanin production. That is why melanin is protective for skin. That is why niacin deficiency, pellagra, melanin deficiency leads to dermatitis. That is a different thing. My question now is, question of NEET exam. Which of the following is not a side effect of niacin? Which of the following is not a side effect of niacin? Options are hepatotoxicity, hyperpigmentation, hyperuricemia, and the fourth option you got in NEET was acute pancreatitis. Fourth option you were getting in NEET exam was acute pancreatitis. Tell me why acute pancreatitis is not a side effect of niacin. Tell me why acute pancreatitis is not a side effect of niacin. Niacin is rather used for treatment of acute pancreatitis. Niacin or hypolipidemic drugs, they are rather used for the treatment of acute pancreatitis. We know this part. Okay? नियासिन डेफिशिएंसी कॉजेस पेलेग्रा बच्चों, यार ऐसे सवाल मत पूछो. यस, सो ये सवाल आया था. So if you don't remember the side effect, you can easily mark that hypolipidemic drugs are given for the treatment of acute pancreatitis. Understood? Now, this completes our main drug. Now let's compare these drugs. Let's compare. Sir, उसी चार्ट पे आ जाओ. हमने एक चार्ट बनाया था. We had made one chart. Sir, come to that chart. याद आ रहा है कुछ चार्ट बनाया था हमने? आ जाओ इस चार्ट पे आ जाओ. My first question, which drug causes maximum decrease in? Fourth option was hyperpigmentation. Tell me now, which drug causes maximum decrease in LDL level? That is statins. That is why statins are the drug of choice for hypercholesteremia. C for cholesterol. Hypercholesteremia, to reduce lipid level, you give statin. Which drug causes maximum decrease in triglyceride level? Maximum triglyceride decreases by fibrate. That is why fibrate were the drug of choice for hypertriglyceridemia. Okay. Next point. Raisins, they increase triglyceride level. Bad. HDL. HDL को तो हमें बढ़ाना है. Which drug increases HDL level? Maximum. Niacin. Which drug is safe in pregnancy? Raisins. Which drug can also decrease lipoprotein A level? Niacin. If you remember this chart, most of the questions will be solved. Most of the questions will be solved. Done? Let's talk about new drugs that will finish hypolipidemic drug. This is an MCQ. Which hypolipidemic drug reduces lipoprotein A level? Niacin. ठीक है, गुड. लेट्स कम टू नाउ न्यू ड्रग्स. तो ये हमारा कंपैरिजन हो गया. इस पे बहुत सवाल आते हैं बच्चों, बहुत सारे आते हैं. ठीक है, गुड. लेट्स कम टू नाउ कहां पे थे? नए ड्रग्स पे. फिर लास्ट में आपको मैं बता दूंगा फेमिलियल हाइपर. चलो पहले फेमिलियल हाइपरलिपिडीमिया भी बता दूंगा आपको मैं. चलो, न्यू ड्रग्स. फर्स्ट लेट्स टॉक अबाउट न्यू ड्रग्स, देन आई विल टेल यू व्हाट इज फेमिलियल हाइपरलिपिडीमिया. लिवर में जब कोलेस्ट्रॉल बाइल नहीं आता ना, तो लिवर क्या करता है? इट इंक्रीजेस ट्राइग्लिसराइड सिंथेसिस ऑन इट्स ओन. दैट इज व्हाई. New drug. First drug. Ezetimibe. Ezetimibe. Very important. Ezetimibe is NPC1L1 inhibitor, and it decreases cholesterol absorption from small intestine. Remember, our small intestine contains one transporter known as NPC1L1, Niemann-Pick-like transporter. So it reduces absorption of cholesterol from small intestine. Use. It decreases cholesterol level or LDL level. Hence it is given as an add-on drug to statin. It is given as an add-on drug to statin for the treatment of hypercholesteremia. For the treatment of hypercholesteremia. Hypercholesteremia. Next drug. ठीक है? You'll write PCSK9 inhibitor. PCSK9 inhibitor. Full form of PCSK9 is not important and you cannot remember. ठीक है? Pro-protein, convertase, subtilin, Kexin type 9 नहीं याद रख सकते, नहीं याद रखनी है. But first point you have to remember. What are the drugs? Evolocumab and Alirocumab. MAB means monoclonal antibody which block PCSK9. Let me finish this, then I will give you break. Now what is the function of PCSK9? PCSK9 degrade LDL receptor on liver. So PCSK9 inhibitor, they increase LDL receptors on liver. Hence, they decrease blood LDL level. Use. Resistant cases of statin. Resistant cases of statin, we give evolocumab and alirocumab. Why? Because they can reduce LDL even more than statins. This is a new class of drug. ये statin से भी ज्यादा LDL कम कर सकते हैं. ठीक है? Third drug. Third drug, you will write omega-3 fatty acids. Omega-3 fatty acids are docosa, hexaenoic acid. Docosa, hexaenoic acid. Icosa, pentaenoic acid. This drug is also known as icosapent. This is important, commonly asked question. These drugs, they decrease VLDL production in liver. Next drug, lomitapide. You can see MTP word coming. It is an MTP inhibitor. MTP stands for microsomal triglyceride transfer protein. Same, decreases VLDL production in liver. This protein is required for VLDL production. You will learn in biochemistry. Fifth, bempedoic acid, new drug. Bempedoic acid inhibit ATP citrate lyase, decreases LDL production. Add-on drug to statin. Second last. Antisense, right? Mipomersen. You'll write antisense oligonucleotide. एंटीसेंस ओलिगोन्यूक्लियोटाइड. अरे ये क्या चीज है यार, बड़ी खतरनाक सा नाम लग रहा है, इसको समझ लो. देखो बच्चों, एक बीमारी होती है. देयर इज वन डिजीज विच यू विल लर्न in biochemistry. This chapter is very much related to biochemistry. What happens in that disease? That is a genetic disease in which there is some DNA mutation. Because of this reason, there is defective mRNA. And that defective mRNA is forming defective protein. Okay. Let's call that defective protein as ApoB100. Let's call that disease as a defective protein as ApoB100 of LDL. This ApoB100 of LDL, liver cannot uptake. इसको लिवर अपटेक नहीं कर सकता ब्लड में. सर एक बात बताओ, इस बीमारी में स्टेटिन्स काम करेंगे? इन दिस डिजीज डू यू थिंक स्टेटिन्स विल बी इफेक्टिव? टेल मी बच्चों, डू यू थिंक इन दिस बीमारी, इन दिस डिजीज स्टेटिन्स विल बी इफेक्टिव? Statins, they increase LDL receptor on liver, but this ApoB100 is defective. In this bimari, statins are not effective. Let's call this bimari as homozygous familial hyper cholesteremia. LDL level is high because LDL is defective. Yes. Then what we have done now, sir, in this bimari, no other drug is effective. The only drug we have is mipomersen. Let's see how it will act. See this diagram. Antisense. Antisense means opposite. Nucleotide. This drug will come and bind to mRNA. It will bind to mRNA and it will inhibit formation of protein. So antisense means opposite strand of mRNA. Normal strand is sense strand. Antisense, it will inhibit translation of mRNA. Protein production will decrease. So that is why it is known as antisense mRNA, antisense oligonucleotide. Any drug which is an antisense oligonucleotide, will end with the word ursane? I will give you 2-3 examples like etipleursane, another antisense oligonucleotide, nusinursane, fomivirsane. So any drug that ends with the word ursane will be an antisense oligonucleotide. कहां यूज करते हैं? Etipleursane. Etipleursane, you will write Duchenne muscular dystrophy. Because in Duchenne muscular dystrophy, there is a genetic mutation, formation of one abnormal protein. Let's call that abnormal protein as dystrophin protein. It will reduce the production of dystrophin protein. You will learn in medicine. Spinal muscular atrophy. Very rare disease. Fomivirsane, vir. It will inhibit the production of proteins of cytomegalovirus. Vir word is coming, virus wala. This drug has been asked many times. I will tell you in antibiotics. Fomivirsane is an antisense oligonucleotide. समझ आ गया concept? I hope you have understood the concept. Good. Understood? Yes or no? Yes or no? Liver will not take LDL. We are reducing the production of LDL. Okay, last drug. एक और बता देता हूं drug. That drug is not used nowadays. N-acetrapib आपकी बुक्स में लिखा हुआ है. Torcetrapib. Last drug. Last drug. This is the last drug. Sir, see this drug. C E T P I inhibitor. CETP inhibitor. Sir, tell me, what was the function of CETP? सर CETP का काम होता था सेल में से HDL को HDL donates its cholesterol to LDL by CETP and this LDL is reuptaken by the liver. Remember CETP? Cholesterol ester transfer protein. So you have now inhibited CETP. So these drugs, they increase HDL level. So these drugs, they increase HDL level. N-acetrapib. But these drugs, they got banned. Why? Because these drugs, they increase the risk of MI and stroke. Anyone, can you tell me why they were increasing the risk of MI and stroke? Why they were increasing the risk of MI and stroke? Sir, HDL तो बढ़ गया, पर क्या LDL का रीअपटेक हो पाएगा लिवर में? नहीं हो पाएगा. LDL will not be reuptaken by the liver. So हमने HDL को तो बढ़ा दिया, but हमने HDL के, we have inhibited the action of HDL. HDL donates cholesterol to LDL, then LDL is removed from the blood. Although we have increased the level of HDL, but LDL will not be reuptaken by the liver. Increase in LDL will cause MI and stroke. Yes. So these drugs are written in your pharmacology books, N-acetrapib and torcetrapib. CETP stands for cholesterol ester transfer protein. You will learn in biochemistry. Cholesterol ester transfer protein. And this completes our blood chapter. After blood chapter, we will now start with, after the break, respiratory system. And in respiratory system, we will start with first asthma. After respiratory, we will start with आइदर एंटी माइक्रोबियल जिसको ज्यादा वोट मिल रहे हैं, और एंडोक्राइन जिसको कम वोट मिल रहे हैं। डन। मजा आया लिपिड्स वाला चैप्टर पढ़ के? ओके चलो, ये भी बहुत इजी है। हेमेटोनिक्स आई विल टेल यू विद कैंसर वाला चैप्टर। व्हेन वी विल डिस्कस कैंसर वाला चैप्टर ना, देन आई विल टेल यू एरिथ्रोपोइटिन, डार्बीपोइटिन, फिलगैस्ट्रिम। ओके चलो, ब्रेक ले लेते हैं यार, कुछ खा पी लो, फायर लगी जा रही है, मेटाबॉलिक रेट बढ़ गया है। सो लेट्स टेक अ 20 मिनट्स ब्रेक। विल रिज्यूम एट 1:25। yes yes we will start antimicrobial। yes yes okay okay antimicrobial done हो गया, antimicrobial start होगा, no more questions। okay familial hyperlipidemia you haven't understood, chalo after the class I will tell you, although it is not a part of pharma, but I will tell you after the class at 3 you will ask me, I will tell you what is familial hyperlipidemia। let's have a break, let's relax now for 20 minutes। your बहुत सारे concept suddenly bombard हो रहे हैं, let's relax for a moment, then we will resume। I will tell you familial type। चलो after the break I will tell you, after the break I will tell you familial type। okay after the break first I will tell you familial hyperlipidemia। let's take a break for a moment। after the break I will tell you familial hyperlipidemia, and then we will start with asthma for a moment। let's take a break। okay let me have some water and all that। okay let's have a break, and after the break we will start with familial hyperlipidemia। okay